Aloha. Welcome to the Fuel Tank Advisory Committee meeting. We're here at the Blaisdell Center today for this one. I'm Keith Matson. I'm the facilitator for this meeting. And I'd like to welcome you whether you're online or in person. At this point, I'd like to turn it over to the chair, Kathy Ho from the Department of Health, to basically convene the meeting and do the roll call. Kathy? Kathy, if you could speak closer to the microphone. Thank you.
I'd like to convene the meeting of the Fuel Tank Advisory Commission. This commission was created by the legislature and it can be found in HRS 342L. According to the statute, the duties of this advisory commission is to study issues related to leaks of fuel constructed underground storage tanks at Red Hill Fuel Bulk Storage Tank, Kuahua Peninsula, Pacific Missile Range, Barking Sands, Hickam POL Annex, and Schofield Barracks Military Reservations. That's our duties. And a recitation of the duties can also be found on the last page of our agenda. I would like to call our roll, and I'll be using the roll as specified in 342L61. So I'd first like to call on Senator Hirono or her delegate. Is anyone present from Senator Hirono's office? Senator Schatz. Is anyone here from Senator Schatz's office? Anyone online? Okay. Representative Case. Representative Takuda. The Senate President designee would be Senator Gabbard. Is he online? The representative for the Speaker of the House, Representative Lowen.
Hi, I just got here.
Thank you.
Oh, yes, I just got here too. I'm Meg on behalf of Senator Gabbard. Thank you.
Thank you. Ryan Imata for the Chairperson of the Board Land and Natural Resource.
Present.
Thank you. Joyce Lynn representing the Board of Water Supply.
Aloha, good afternoon.
Joyce, if you could speak closer to the microphone, as close as you can. You can move it as close as you need to.
Okay.
Thank you.
Present. Okay. Thank you.
Kira Kahahane representing the Chairperson for the Commission on Water Resource Management.
Aloha, I'm here.
Thank you. Representing EPA, Allison Fong.
Hi, everyone. Present.
Thank you. Representing the public, Melanie Lau.
Here.
Thank you. And Ashley Nishihara.
Present.
Thank you. Is there anyone here representing the Commanding General of the United States Army Pacific or Commanding General or his designee? Okay, anyone representing the Commander of the Pacific Fleet of the United States Navy?
Hey, good afternoon. This is Robert Williams.
Thank you. And the Commander for the Pacific Air Force. Is anyone here representing the Pacific Air Force? Thank you. Roll has been called. Thank you. I'll turn that back over to you, Keith.
Okay, great. Thank you very much. So before we get into the agenda itself, I just want to go over a few things for today's meeting. Many of you have been to FTAC meetings before, and this one, there's a few things that are a little different. So I wanted to point those out today, first of all. Most of our presenters for today's meeting are online due to circumstances such as travel or other things. They will be visible on the screen, of course, and we can interact with them when it comes to FTAC member questions. This is, of course, set up to be a hybrid meeting. We always strive to do a hybrid meeting that works well for everyone. And I want to thank the University of Hawaii Information Technology Services and From Above Entertainment who are collaborating today to give us this one. We can only control the technology we have here in the room. If things happen outside of our control, we'll do the best we can. But just be prepared. We'll try to make workarounds if somebody's having connectivity problems elsewhere. This particular meeting is not being broadcast on Olelo because Olelo could not provide a crew for this date. So, but it will be videotaped and archived and put on the Department of Health FTAC website, just as the other ones have been in the past. One other thing to note is if anybody in the public here wants to comment later on when we get to the public comment period, please sign up so we know to call upon you, obviously, and we will call upon people in the order they signed up. The sign-up sheet is being run by Roxanne in the back, so if you need to do so, please do so. Of course, for the online participants, when we've reached the break, after the break, we'll ask you to raise your digital hand if you want to speak, and then you'll be put in the queue by Zoom automatically, and we'll just go in the order that is in front of us. Let's go to the slides, facilitator slides today. Okay, we're already up there. So here we are, we're getting over our opening remarks, and we're just about to go into the agenda, which will have a series of presentations by University of Hawaii, the National Academy of Sciences, the Navy, and also EPA and DOH representatives, and University of Hawaii. So that will run for a good amount of time. We're going to take a break actually midway through because it's about time when we get to 3 o'clock. People need a break. And when we have a break, or even before then, the restrooms for the people in the room are out. You walk into the walkway, go down to your left, and you'll see them against the wall. Then after the last item, which is the discussion about the future FTAC meeting frequency, we'll go into the public comments and questions. I assume that will be sometime around 3:30 to 3:50, depending on how we do with time. And then we'll adjourn at 5. So that's it in a nutshell. If we could go to the next slide, please. Most of you are online or veterans at this, but this is a webinar, so you don't have to worry about muting your mics or your video because that's already done until and if during the public comment period you wish to weigh in. And then you'll be queued by our webinar operator to do so, to unmute yourself and be visible. The chat is enabled for people on Zoom, but it's not visible inside this room. Then that's really about it that I wanted to cover on this particular part. If you have any technical difficulties, try logging back on if that's an issue, but we'll do the best we can to keep you connected. Okay, next slide, please. This is sort of, I think, common for a lot of meetings. We're here to, quote unquote, share the airspace. It's a dialogue, it's a chance to learn. And the most important thing is to try to be direct, succinct, but polite. And I think everybody can do that well. Let's all learn as much as we can today and try to be direct and succinct in our questions and comments. That's all I have to say. So what I would like to do now is go to the agenda, the second item on the agenda, and that is a couple of presentations on public health matters. First of all, is Liz Boyle online at this point? Liz, are you in the room? Okay. Liz, thank you very much for joining us. You're on East Coast time, so we wanted to have you first. But please go ahead and tell us more about the updates on your study.
Yeah, sure. Thanks so much for inviting me. Can everybody hear me okay? I'm
Yes.
assuming yes, because you've been replying. All right, I've got just a couple of slides to share with you guys. Do you see the slides?
Yes.
Yes. Okay. So as you guys all know, because I spoke a few months ago at one of these meetings, I'm from the National Academies. I'm a senior program officer and study director, and I'm the director of this study that we have on clinical follow-up and care for those impacted by the JP5 releases at Red Hill. And so just as a reminder, what are the National Academies of Sciences, Engineering, and Medicine? We're a non-governmental organization that advises the nation on issues related to science, engineering, and medicine. And we have two missions. One is that we serve as an independent scientific advisor to the nation through our operating arm, and that's where I work. And then we also honor top scientists through our three academies: sciences, engineering, and medicine. It's important to know that we're not part of the government. We're not an advocacy organization, and we don't consult to for-profit entities, and we're also not a research laboratory. And so we work through independent committees who are unpaid scientists that write reports that provide advice. And this is the committee that we have appointed to write the report about Red Hill. And it's chaired by Grace Lee, who's a professor and clinical faculty and clinician with Stanford University. And then this is my lovely staff team so this project has a lot of support through it. And so just to remind everybody what the consensus study process is, we start with our study definition or statement of task, and that is defined in collaboration with Academy staff and our study sponsors, and this project is sponsored by the DoD and the Department of Veterans Affairs. And then we, after our contract is awarded and the scope of work has been worked out, then we begin selecting our volunteer committee. Then we move into what we call our information gathering phase, and that's where we are now in the process. And National Academies committees gather data or information through our public meetings. People submit things to the committee. We have an email address, redhill@nas.edu, where people can submit things to us for the committee to review. We also conduct, and that's one of our main things, is we conduct reviews of the published scientific literature. And then we also sometimes do other types of committee investigations. And so after and sometimes in parallel, we start to develop the report. And then we'll draft our findings, conclusions, and recommendations. And then all of that goes through a really rigorous peer review process. We have 16 committee members for this committee, and there'll probably be that number of peer reviewers. And then once the peer review is completed and the Academy leadership determines that the report is ready to be released to the public, then we'll release it to the public. It's important to know that we have this arm's length relationship with our study sponsors, and they can have the report for a maximum of 10 days before it's released to the public. So they can't influence the recommendations, findings, or conclusions. And so here we are with our study timeline. So we've completed that committee formation phase, and we had our first committee meeting, which I think many of you attended in February, on February 20th. And then we are continuing with that information gathering phase. We had a community listening session last night, and then we have another one. Well, I'll tell you that on a later slide. We have other ones coming up. And then an important other thing to know is that we've got a trip to Hawaii that we're planning in starting June 24th. So, and then the report will go into peer review in October of 2025, and then to be released to the public in March of 2026. And so just to remind you all what our statement of task for this project is, the crux of it is that we're supposed to recommend guidance on clinical action to monitor the health of community members who were exposed during the November 2021 release of JP5 aviation fuel from the Red Hill bulk fuel storage facility. And we have several different sub-bullets to the statement of task for how we're going to make those recommendations. And one of them is that we're supposed to engage with exposed community members. And so that's what we started doing yesterday with the virtual listening session. And then we'll also review the strength of the evidence for the putative health effects of JP5 from scientific literature. Then we'll also review any existing clinical guidance so that we can issue evidence-informed recommendations. We'll also consider exposure assessments that could inform clinical follow-up. And then using all of that information that we've gathered and assessed, we'll provide our recommendations and identify research needs. And one thing that's really important to know is what's not included in our statement of task. And so these are things that the report cannot address. And so that's determining any liability or fault for specific conditions. So if you have an outcome, that a health outcome or disease that you think is or that you feel is attributed to your exposure at Red Hill, we're not going to be able to say with our report that specific fault or liability for that condition. We're not making any recommendations on environmental remediation or cleanup. We're not making policy recommendations beyond guidance for clinical care and follow-up. We're not deciding who should pay for medical care or expenses. We're not doing any long-term community recovery, such as infrastructure repair. Those type of things are out of scope. And we don't conduct original clinical or toxicological research. Community engagement is really an important part of our statement of task. And so some of the tools that we're using in our study is that we have appointed a group of community liaisons. And the goal, we meet with a group of community members once a month. And the goal of that is to try to build trust with the affected community between the National Academy staff and the affected community. And the liaisons can serve as points of contact, and they relay community input to the national academies. And so their responsibilities are to communicate with staff and represent community perspectives at some of our public meetings. And so many of the people that attended the meeting we had last night were members of our community liaison group, though other members of the public were welcome to join that as well. And so the virtual listening sessions are what we started yesterday, and the goal of those is to gather input from community members who were exposed to the JP5. And the topics that we're covering are public health response, healthcare services, any long-term symptoms, and also mental health. And then the logistics are that we held them through Zoom with advanced registration, and we facilitated conversations. And they were recorded, but the recordings aren't going to be made publicly available. They were just for committee use for, because we'll use them to inform the report. And then we're also going to have an in-person town hall and some site visits to the Red Hill facility on Oahu. And the goal of that is to provide the firsthand insight into the community experiences and perspectives. And then we'll also, during that meeting, have some sessions with community speakers discussing their experiences as it's aligned with the study statement of task. And so that is in person. And then we'll also have public speaking slots at any other open meetings that we have throughout the study. And so as I alluded to or said earlier, we have here's what's coming up in the Red Hill study. So on April 15th, we're having a virtual listening session on mental health impacts of the JP5 release. And then also May 3rd, we're going to have one on pediatrics. And then on the 24th to the 26th is when we'll have in-person meetings on Oahu. And then hopefully in July, we're still working to schedule that with the committee. We're going to have another virtual data gathering session, and we're going to release a community perspective survey because not a lot of people that were exposed haven't been able to join us at the times that the committee was available for the virtual listening sessions. And so thank you. That's it.
Okay, thank you very much, Liz. Are you still available to hang on for additional questions after our next presenter?
Sure,
Okay, great. I
happy
appreciate
to.
that. Okay,
Thanks so
but
much.
before we go to our next presenter, does anybody on the FTAC committee have any like clarifying questions you want to initially ask from our speaker, Liz Boyle? Yeah, Ashley. And please speak as close as you can to the microphone.
Okay. Hi, Miss Boyle. I
Hi.
had a couple of hi. I had a couple of questions regarding the scope of work, like what is and what isn't included in the scope of work, because I was confused about some of that. And one of the question is, patients suffered long-term effects. What is the purpose of this whole study if long-term community recovery is not the goal? Like I was confused what
No, So
infrastructure.
we're not figuring out like how to protect the water supply. That's what I mean
Oh,
there.
okay.
Yeah.
That's what
What
infrastructure.
what we're talking about, like infrastructure. We're not talking about the improving the infrastructure should, someone think there needs to be. And I don't have the right people appointed to my committee to do that. We're making recommendations. So our sponsors are the VA and the Defense Health Administration. And so our recommendations are going to inform clinical care for those that seek services from those sponsors. I mean, that's a direct impact that will happen. And like we do a lot of work for the Department of Veterans Affairs. And so like if you're familiar with Agent Orange exposures, so we write reports that say the strength of evidence for exposure to Agent Orange and different health outcomes. And then the VA uses that review to determine what's a presumptive condition. And so then people get health care actually paid for by VA for those conditions. And so that is something that could result from this report. And so, because we're weighing the evidence for the strength of evidence for exposures to jet fuel.
Okay,
Um,
gotcha.
yeah,
Thank you
and
for
then there's a little bit of a difference here between just between our scope of work and what we typically do for VA in that, we started doing research into the potential health impacts of Agent Orange in the 90s. And so, that was much longer. Usually we're involved much longer after the exposures took place. And so this is a little more of like a preventive care and not just what I expect the committee may make recommendations if they can determine that there's not additional harm caused by additional care, but they could make recommendations that are like, you should get more testing for X, Y, and Z because you might be at higher risk for, heart disease per se, or something like that. So it might be a little more of the presumptive, or a little more from the preventive, whereas with a lot of other VA reports that we've done, it's more treatment for the condition once you've developed it. So maybe that was too wonky, but hopefully
that.
that helps.
Oh, thank you. Yeah, because that actually, brings me to my next question, which is like a part of the list of stuff that's not under your scope of work is like toxicological effects and clinical effects.
Yeah,
But my
yeah. What
question,
I mean by that is that
yeah.
we're not taking rats and dosing them with jet fuel. Like we don't do the toxicology experiments. We're reading literature.
Oh, okay. Yeah,
Yeah.
because my question was going to be like, if you don't know the toxicological
Yeah.
effects, how can you then inform clinical follow-up and provide recommendations on clinical surveillance testing and care, which are
Excellent question. Yeah. I mean, if you have to, there needs to be research for us to make recommendations. So sometimes if there's really, like if something's really been unstudied, like in I think it was 2009, we did a report about the health impacts of burn pits that was kind of unliked by some people, because we said that there was no evidence of burn pits causing harm, but that wasn't meaning that it was fine. It meant
Yeah.
it meant at that time the evidence wasn't clear. So sometimes things can have like a limited field of evidence to inform this, the the weight of evidence. So sometimes that can happen. So
okay. Thank you. Thank you for
okay,
clarifying.
yeah, happy to.
Dr. Lau?
Hi, Elizabeth. It's
Hi.
Melanie. I was on the session last night and I was mostly listening. You mentioned, well, first I wanted to say that you guys run a really good show. You stay on time, you are flexible with the agenda when you have to be, and you quit on time. And I think everybody felt valued too, all the participants, which is actually very important.
Thank
Um,
you. Thank you.
yeah.
We work really
So
hard to do all of those things.
yeah, you guys really achieved it, I thought. There are two things. One was you mentioned that you were saving the chats so that you could also get people's testimony that way, which I think is great. And you also recorded it because then somebody can go back and also make a transcript and have testimony that way. But it seemed like there were only maybe 9 people who actually were able to speak that night. So do you have a way of letting other people in the community know about that
So
redhill.au website
64
or something?
people registered, but
Okay.
only those like 9 or 10 joined. And that's kind of common for these type of public meetings because we're free. So that's one thing. And then also I think there were some people that registered and realized later that they weren't really part of the target audience.
Mhm.
We had, people in Canada that like work for Health Canada, that kind of a thing. And so that's some of it, but we're also allowing people. So, I mean, I think some people just couldn't join because of busy schedules and all of those things. And so we are gonna, have a web survey where people can provide written input for the committee to consider too. Yeah.
I'm also wondering if you can piggyback on with the UH Red Hill Registry people. I mean, that's up to you guys what you want to do, but you might be able to put the word out a little bit more to get people to answer
Well,
your questions and surveys.
yeah, sure. I'd be happy to do that. I mean, we did do paid advertising on Facebook, which is
Mhm.
how probably we got 64 people to register. And so we've done a lot of that. We've did paid advertising to get the committee formed, and I emailed everyone that was nominated for the liaison group specifically, because that was the right target audience for this type of conversation. So we have done a lot to get people engaged.
Great. I guess I also
Mhm.
want to address something that Ashley brought up is the toxicological studies.
Mhm.
I think later on in your agenda of things to do, you also said you were going to look at the scientific evidence that is out there, which may not be that much, but I'm assuming NASEM is going to get to that stage and will cull the data and also put it together succinctly in your report.
Yes. That we do like a whole, not exactly a systematic review process, but we have a very systematic process for how we review and assemble evidence to make those weight of evidence determinations.
Okay, great.
Yeah.
Thank you.
Okay, so if there are no further questions of Liz, let's move to the next presenter on the public health issues, and that would be Tara Sutton from the University of Hawaii's Red Hill Registry. Tara? Before you start, yeah, there, good, thank you.
Okay, there we go. Thank you so much for inviting me back to speak today. In case I haven't met anybody who's here today before, my name is Tara Sutton. I am the Director of Community Engagement for the Red Hill Registry. And last time we presented in October, they gave a great rundown. My coworkers were here, and I want to give a kind of a 6-month update as to where we're at today. Next slide. So 6 months ago, we shared that our year 1 was going to be focusing on our planning phase. Our 3 major priorities were building the registry's infrastructure and co-creating the registry through community engagement, and then finally fulfilling the congressional requirement to assess the feasibility of a health outcomes study. So let's kind of walk through those 3 main things here real quick. Next slide. We have been developing our infrastructure, and what this includes is finalizing job descriptions, interviewing and hiring, onboarding new team members, and creating data systems with an emphasis on security, consent management, and participant protections, excuse me. We're also researching best practices for how to deliver participant incentives, something Liz brought up to increase the number of people we can hear from. And we've made major improvements to our website and support for pre-enrollment, and then also access to resources and overall transparency. Next slide. So here is our latest version of our website. When we were here before, it basically was just a button that said, click here for email updates, and we're growing. So what you can do is visit redhillregistry.org or use the QR code in this image. If you receive the slides via PDF, that should also be clickable. This is where you can complete a pre-enrollment questionnaire. There's also an option for anyone interested to sign up for those email updates and follow our progress. As was brought up, if Liz and NASEM wanted help with sending emails, that's something, we can talk about. So we've also added up at the top, you can see across the banner, we have news and reports and an employment tab that's good to keep checking because it is regularly updated with the positions that get posted. So in the next few months, we expect to post near a dozen new positions, and they'll all be based here in Hawaii and be seeking all levels of experience and education. So please don't ever rule yourself out, check it out. And we definitely welcome applicants who have lived experience with the Red Hill water crisis. Next slide. So our team continues to grow. We're proud to be working across the disciplines and institutions of UH. We have public health, clinical medicine to environmental science and community outreach. So we're building a really deeply collaborative team that includes experts from UH, JABSOM, the Water Resource Research Center, and the University Health Partners of Hawaii. Just in the past month, we've welcomed about 5 new staff members. Next slide. As part of our community outreach efforts, we're also launching social media presence under the handle @RedHillRegistry. So you can find us on Instagram, Facebook, Threads, X, and YouTube. There's not a lot of content yet, but check in, be patient, like and follow, do all the things to help us grow. This will also help us to reach people who may no longer be here in Hawaii, but were also impacted by Red Hill. As we know, there was a large military population and they are since dispersed globally. The QR code on the slide, if you scan that, it will send us an email. So if you haven't already, we invite you to come and like and follow. Next slide. This is a very wordy slide, so don't worry, you'll have time to read it on the PDF. But one of the main focus of our functions of the registry is to provide needed referrals and resources across a variety of topics. So the referrals the registry will provide are not necessarily formal referrals, such as when you think going to a medical provider and they set you up to see the next medical provider. That's not what we mean in a registry type of a platform. This is more of a providing resources, education, and support to impacted community members, as well as to healthcare providers who may be caring for the community and not know how to care for a patient who drank jet fuel. The community has shared with us the many ways that Red Hill the Red Hill crisis has impacted their life and how the registry can help, not just with medical concerns, but also with legal concerns, housing concerns, employment, education related, and more. So through our community resource and referral platform, or CRRP, if you see the abbreviation anywhere, that's where we're building a structure that will support these referrals across areas that the community says matters most and is also accessible wherever our community is. Next slide. In tandem with that, we're planning educational programs tailored to different audiences, including fact sheets, as well as clinical guidance for healthcare providers and materials for affected individuals and families. So the community members have been asking that these materials be presented in different formats. We're planning on creating podcasts, videos, brochures, maintaining a social media presence, and providing opportunities for community members to connect with each other directly. Healthcare providers, on the other hand, have requested literature on the exposure scenario, continued education training on relevant topics, such as the kind of care that Red Hill community members appear to need as a result of this crisis. General topics might include the history of Hawaii and the military presence here, trauma-informed care, including cultural trauma training, indoor and outdoor environmental health, legal protections for survivors and for healthcare providers, blueprints for crisis management should something like this happen in another area. They don't have to recreate the wheel. Hopefully it never happens again anywhere. But we've also been asked to provide some information regarding pet health and how people's pets or service animals may have been impacted by the fuel water. Next slide. Community engagement remains at the heart of our approach, of course, and so a lot has happened since October. Next slide. Here's kind of a quick high-level timeline. Between November and December, we conducted focus groups with 25 participants from a diverse group of participants across the community, the Red Hill community, and collected 58 community survey responses. So as you pointed out, sometimes people will register for these things and not attend. So we put a community survey out and received 58 more voices through that. Participants self-identified as either exposed Navy water users, concerned Oahu residents, and professional service providers who were available or involved in the response effort. In December, we opened pre-enrollment for individuals who believe they were exposed, and that was followed by a public town hall in January, which is going to soon be available for a replay on our YouTube channel once we get that fully approved and all the editing done. Then in February, we launched our community advisory work group. I affectionately call that the CAW. And they are a small group of volunteers providing feedback to the registry in whatever capacity is needed. They help us to stay grounded in the community's priorities. March focused on logo development, and this month we're preparing educational and outreach programs based on what we've heard so far from the community. So throughout the whole past 6 months, our science team has been conducting a media analysis, a thorough literature review, and constructing the baseline enrollment survey. Our data experts, our water data experts have been testing, this is just data. Our data experts have been testing our IT platforms and parameters to ensure data security once we do launch. And then the water research team has begun working with the data from the Navy's Safe Water website to create some really remarkable maps that tell a visual story of what occurred on the Navy water lines from 2021 and present. Next slide. So this is the fun part because it's done. The congressional report. Go to the next slide, please. This QR code, again, in the PDF version, you'll be able to click it, but you can also just scan it here if you would like. But this was one of the first major tasks that we were given as a team, was to prepare a report to Congress on the feasibility and necessity of conducting an epidemiological health outcome study. So this report required us to just really jump right into the issues, explain what happened, as well as intended recruitment strategies for the registry, methods for assessing health outcomes, data analysis, identifying exposures, and registry enrollment criteria, as well as providing resources and education. It's a very thorough and comprehensive report. I recommend you grab that, take a read. It's good stuff. Of course, we concluded that an epidemiological health study is both feasible and necessary. So this was submitted to Congress on time, and you can find it on our website if you don't get this QR code. It's at redhillregistry.org, and you'll see it in one of the banners. Okay, next slide. So the challenges. So there's always going to be challenges ahead. The next slide will kind of detail, everything is roses. Go ahead and advance. Everything is roses, but every rose has a thorn, right? So we are also making sure to be very realistic in our optimism. And we realized that, with our pre-enrollment data, what we've realized is we've been able to confirm that the Red Hill community definitely is geographically dispersed across the globe with varying levels of access to healthcare. So we've also been able to identify these feelings of distrust and institutional betrayal that remains strong. So we're navigating these issues, especially among those who feel harmed by the very institution that they've both relied on and sacrificed for, by focusing on being forthcoming, accessible, and transparent in everything that we do. One of the more complex challenges is determining how to define the scope of data that we collect through the registry or the registry enrollment criteria. This is a really highly mobile community with mixed use spaces and a decades-long history of exposure, all of which complicate simple geographic or time-based boundaries as we consider this. So we're leaning into the community and asking input to help guide those decisions thoughtfully and respectfully. At the same time, we're committed to making educational materials, resources, and the referral support as widely available as possible, even beyond those formal registry enrollees, so that we can grow our reach responsibly, one step at a time, as our funding, team capacity, and infrastructure to hold data continues to expand. Next slide. This is the big fun one. We will have a formal enrollment event later this year, around July and early August. So keep an ear out for that. Sign up for email updates to make sure you get informed at redhillregistry.org. Next slide. As we continue moving forward, we remain focused on building something that is scientifically sound, culturally grounded, and truly co-created with the impacted community. So on behalf of the Red Hill Registry team, I say this all the time, but thank you so much to the community who saw a problem and recognized that and fought for these answers. And also thank you for continuing to show up, ask questions, and holding us accountable. Next slide. Are there any questions?
Yeah, so thank you, Tara, for that very comprehensive description of the registry as it exists now. Let me open it up to FTAC members if you have any questions. And we're trying to keep on time, but I understand this is, maybe important to, vet some of this from your perspectives. So Ashley.
Yeah, I'll keep it brief, but I just want to, it's more of a statement than a question. I just want to, thank you for doing that report, because there needs to be a health outcome study and research done on toxicological long-term effects in order to be able to directly address that challenge of relaying information to doctors around the world so they can properly address the symptoms that patients are having. So yeah, thank you.
Okay, thank you. Anybody else? Okay, well, and also Liz Boyle is still online. She's graciously hung on from the East Coast. Are there any other questions anybody has for the National Academies study or any of the joint work, I guess? Okay, great. Liz, I just wanted to ask one thing, maybe of the National Academies ones. Obviously, you're not doing any primary research, but will your recommendations include suggestions for specific types of primary research that should be done?
We could. Part of the task is to look at evidence gaps and make research recommendations. And so that could include a lot of different types of primary research.
Okay, great. Well, thank you both for all the information you provided, and please stay tuned. They gave you a lot of details about what's up ahead. So Allison, did you have a question?
Yes, I did have one question for Tara. Thank you for sharing that update on the Red Hill Registry. We wanted to know relatively what time do you guys expect releasing the analysis of the data from the Navy Safe Waters website?
Am I on? Okay, so we aren't necessarily analyzing it. We're just kind of mapping it out with our water resource team. When that would be available, I'm not sure. I would assume closer to our formal launch, when we have resources that are like finally able to be published and go public.
Okay, so that would be roughly
August.
I
can't promise that. I know this is recorded. Don't hold me to it, because I can't verify for that team without speaking back with them, but I can definitely follow up.
Great. Thank you.
You're welcome.
Okay, great. Thank you again. So actually, we're right on time. So let's move into the next agenda item, which is a update on the Red Hill bulk fuel storage facility. Many items under there. And I'm going to turn it over to the Navy's team. And I believe Admiral Williams, are you on board there?
I am. Can you hear me?
Yes, we can. There's a little bit of echo, but your signal is loud and clear. So please go ahead.
All right. Hey, so first off, thank you for having us today and for the opportunity to update you on our progress. I'm Rear Admiral Mark Williams, and I'm the Deputy Commander here at the Navy Closure Task Force. Before we get started, let me address the decision the Navy made to attend this one virtually. Attending virtually really maximizes our time that we're able to spend at this important meeting while also meeting our other commitments here in the office as well as out on the site. With me today, to my left, I don't know if you can see him on screen or not, be on your right on screen, is Commander Ben Dunn, our Deputy for Environmental Monitoring and Remediation, and also part of the Navy briefing team that will go over other field constructed the underground fuel storage tanks. Our Captain James Sullivan, the Regional Engineer here at Navy Region Hawaii, Colonel Monica Grambling, Deputy Commander for the Joint Base, and then also joining via Zoom from Kauai is Captain Brett Stevenson, who's the commanding officer for the Pacific Missile Range Facility. So with that, next slide. All right, so since the last FTAC meeting in October, the task force has made substantial progress in the decommissioning of Red Hill. March 28th of this past month marked our 1-year anniversary of the establishment of the Closure Task Force. And we've been working alongside federal and state regulators as well as the Oahu community to safely and expeditiously close the Red Hill fuel storage facility in accordance with our mission. Pictures are worth 1,000 words. So with that in mind, I'm going to walk you through the pictures you see on the screen to update you on our progress. So if you look at photo number 1, we began pressure washing the tanks in January of this year, and we've actually completed 2 tanks so far with another 4 tanks in progress. If you go to picture number 2, the wash water for the tanks cleaning is conveyed via a pipeline collected in a tank outside of Attic 3. And then you'll see as we transition into what tank ventilation, and that's photo number 3. This shows the equipment that is installed to ventilate the tanks. So remember, one of the first steps in the tank cleaning process is that we need to ventilate the tanks, and this step allows the workers to safely enter the tanks so that they can begin the tank cleaning process. So far, we've completed ventilating 5 tanks, and those are tanks 3, 5, 7, and 8. And then just last week, we started ventilating tank number 4. Prior to ventilating the tanks, we installed 9 air quality monitors around the perimeter of Red Hill. And photo number 4 on the screen shows one of our team members checking an air quality monitoring station. Since we started the ventilation operations in May of 2024, there have not been any elevated, and I'll say that again, there have not been any elevated volatile organic readings or VOCs. And if you're interested in the data, to keep you all informed, during the ventilation operations, we post the air quality monitoring reports hourly on our mobile app and daily on the actual Closure Task Force website. If you look at photo number 5, that is a snapshot from inside a tank where you can see the scaffolding that is set up inside that supports our tank cleaning efforts. And that scaffolding, that viewpoint there is about 200 feet above the bottom of the tank. So moving on to 6, this shows a drilling rig used to drill groundwater monitoring wells. Just last month, we completed the installation of our 46th actually, groundwater monitoring well, and we are mobilizing now at the site of our next location. The groundwater monitoring wells are a key component to detecting and monitoring pollutant movement and to inform the groundwater flow model. And I want to note that we did submit our updated groundwater flow model to the Department of Health, the EPA, and the University of Hawaii in September late last year. And we will continue to iterate and refine our model as we get new information. The University of Hawaii is also developing its own model, and that is an independent effort. We will use that model to better inform our model once they release their findings. And they're also conducting a dye tracer study that is ongoing right now to get a better idea of how the groundwater moves in the Red Hill area. And we plan to also incorporate that data into our model as well. And the key point to remember here is the model is a living document that will continue to be updated and iterated on with the latest data as we move forward. You move to photo number 7. This shows the 12 granulator activated carbon filtration tanks, commonly referred to as GACs, that were recently installed at the Navy IA Halava shaft. In consultation with the Department of Health, the Navy is planning for the reactivation of this shaft, which is currently not connected to the Joint Base Drinking Water System. As part of this plan, we are launching a pilot study of the GAC system to collect data, and that will demonstrate the effectiveness of the treatment system. I want to call out that the reactivation of this shaft will demonstrate the Navy's commitment to resiliency, to redundancy, and to the security of our Joint Base Pearl Harbor Hickam drinking water system, and the Navy's continued compliance with federal and state regulations for safe drinking water. But I do want to reiterate, this shaft is currently not connected to the drinking water system, and only after receiving approval from the Department of Health, we then inform the public prior to actually physically reconnecting the shaft to the Navy's drinking water system. And then finally here on photo number 8, this is a photo of a soil core sample taken from the drilling rigs. Studying these core samples allows our experts to develop an advanced understanding of the subsurface conditions, which further helps inform future cleanup and sampling efforts. Next slide, please. Okay, I think it's a little blurry. Hopefully it's clear on your end, but again, I want to remind folks that tank cleaning is a major component of the decommissioning of Red Hill, and we are on schedule to complete this in 2027. The slide here, you'll see the deliberate 4-step cleaning process that we follow for each tank, and you can see the status of each tank in the lower diagram corresponding to the color step that they're in. And I'll walk through here where we stand on each tank that's color coded. So tanks 3 and 4 are in step 1. They're undergoing tank ventilation and degassing. Tank 5 is in step 3, where we are installing infrastructure to support the pressure washing. Tank 6 is also in step 3, but we have to remove a spiral staircase first in order to install the infrastructure that is required for pressure washing. And then tank 7 and 8, the pressure washing is complete, and we've submitted the quality validation reports to the Department of Health and the EPA in accordance with the regulator-approved tank cleaning quality validation plan. With regards to the residual product removed so far, we've safely removed 949 gallons of residual fuel from the tanks, which includes fuel recaptured in pipelines and valves associated with the tanks, and then another 178 gallons of the sludge from the tanks that we've entered so far. You can track detailed progress of each of these tanks via our interactive dashboard on the Closure Task Force app, which is available on Apple and Google Play, and we'll have a QR code at the end that you can also scan for quick access. So next slide, please. So moving on to the next big effort for decommissioning, which is the pipeline removal. So preparations are ongoing to remove and retire over 10 miles of pipeline from the facility, with cleaning starting this spring and removal starting in the fall. The pipelines will be systematically cleaned prior to removal. And to date, our crews have been placing equipment and setting up infrastructure to support pipeline removal for the last several months. Throughout the entire process, we will provide extensive oversight of the contractors to decouple and mitigate environmental risks, as well as safety risks. The pipe material is all being recycled on the mainland, and pipe removal and retirement is currently scheduled to be completed in 2028. And I want to be clear with everyone, this is a very long and incredibly complex job, and our team is going to move at the speed of safety, and we will continue to do that throughout this. Now with that, I'm going to turn this over to Commander Dunn, who's going to go over an update on environmental and water.
All right, aloha and good afternoon, everyone. Commander Dunn here. First, I'd like to thank you for the opportunity today to provide an update of our important ongoing work, and to thank those also listening in. First, I'll highlight the various environmental work that's been ongoing at Red Hill and a look forward. So over the past year, we've made a significant amount of progress. Navy Closure Task Force Red Hill has conducted multiple activities, all of which were extensively coordinated with the Hawaii Department of Health and the Environmental Protection Agency. A specific note, we've done many things, including initiated the site assessment process with detailed planning and preliminary field sampling to inform our sampling approach for the upcoming field investigation phase. We've also implemented strict air quality monitoring efforts in support of tank emissions to support the tank cleaning operations. We've reduced pumping of the Red Hill shaft by over 50% volume, from an average of 4 million gallons a day to 1.8 million gallons a day last spring to conserve water while sustaining a groundwater capture zone at the site. We also began a remediation pilot to evaluate the feasibility of soil vapor extraction technology for use at the Red Hill site. We've completed installation of multiple groundwater monitoring wells and completed and submitted a comprehensive update to the Navy's groundwater flow model last fall. We've also continued soil vapor monitoring at the fuel facility and have conducted ecological monitoring of Halava Stream. Looking forward over the next year, we will continue many of these efforts, including additional ecological monitoring, air quality monitoring, and soil vapor monitoring. We'll continue pumping the Red Hill shaft and treat the effluent and sustain a capture zone on site. We will continue planning and drilling additional groundwater monitoring wells in and around the Red Hill facility. We will begin our site assessments, field investigation, key effort for the environmental piece. And we'll advance and refine our groundwater flow model this year and again next year once we get additional findings and information from UH's effort. And we'll complete a soil vapor extraction remediation pilot later this year. Yeah, next slide, please. For the drinking water, I'd like to overview. This slide depicts the comprehensive and methodical approach taken by the Navy over the past several years to recover the Joint Base Pearl Harbor Hickam drinking water system. In total, during that time, the Navy's collected over 16,000 drinking water samples from the system since the end of November 2021. And following the November 2021 release, the Navy and Army joined the Hawaii Department of Health and the US EPA to establish the Interagency Drinking Water Systems Team in December of 2021 and developed a recovery plan for the entire drinking water system. That plan involved the zone-by-zone flushing and confirmation sampling with additional follow-on monitoring. Thereafter, in March of 2022, we completed the zone-by-zone flushing efforts, and DOH then amended its health advisory and certified the system as safe. The Navy then began a 24-month drinking water long-term monitoring program to demonstrate that the system had recovered. And in early 2024, the Navy committed to extend enhanced drinking water monitoring efforts and voluntarily initiated the Extended Drinking Water Monitoring Program, which was ultimately approved by the EPA late last year. Last month, the Navy completed the Extended Drinking Water Monitoring Program sampling efforts, having sampled over 98% of the homes served by the Joint Base drinking water system. Throughout LTM and the Extended Drinking Water Monitoring efforts, we've collected more than 16,000 samples, and we have never detected JP5 in the system. The long-term monitoring and extended drinking water monitoring programs also included input from third-party experts we've done in conjunction with the EPA and DOH each step of the way. We're working on the extended drinking water monitoring final report as we collect the final validated results from that program, and we will be submitting that to the regulators this spring for endorsement, after which the Navy will return to routine compliance monitoring of the Joint Base Pearl Harbor Hickam system. Next slide. Back to you, sir.
Okay. All right, so I talked about this earlier. Here's the QR codes, but these are all the online resources where the public can find more information about our task force's activities. On the website, you can find links to the document library. You can find photos and informative videos that we've created, as well as you can find a listing of all of our upcoming public engagements to include our next open house, which will be held May 21st. We'll have some more detailed information to come on that as well. We also host webinars to help educate the public on our mission. The next one is scheduled, or it's supposed to be scheduled maybe later this month, but most likely early next month. And that will be on our plans to reactivate the Navy IAEA Halava shaft now that we have conditional approval to do so from the Department of Health. You can also find the schedule for our drinking water information booths, which our team hosts in various locations throughout the communities on our water system. At these information booths, residents can learn how to look up their water test results on the Safe Waters website, and learn what all the data means. There's also the QR codes there to download our app, either on Apple or Google Play. There you can find our Let's Talk Red Hill podcast, where we upload new episodes every week. And again, there's that interactive dashboard from the slide previously where you saw the tanks, where you can follow our progress down to details for each individual tank. Thank you for your time today, and we'll stand by for FTech member questions.
Okay, what I'd like to do at this point, well, let's actually take any clarifying questions. We can come back to the presentation later on after EPA and DOH have weighed in on the regular updates. But does any FTech member have a question of the Navy team now about what was presented? Okay, Ashley?
Hi. For the pipeline removal slide, what are these robust containment measures you're talking about? Like, what's involved with that?
So each, there's going to be 3 levels of containment, right? You're going to have a primary, a secondary, and a tertiary, right? We're going to have spill mats in place. You'll have catchment areas, booms, and really the thing you're going to realize is each cutting section is going to be a little bit unique. There's going to be some common areas where we'll do the same essentially configuration of containment in place, but for a lot of these, especially in the tank gallery area where it's all intertwined with other infrastructure, it's really going to be site dependent on how it is set up. Ultimately, there's going to be oversight by a spill response team throughout all cutting, and before the contractor is allowed to cut, our environmental team will sign off on that all the appropriate levels of containment are in place, and that we can proceed.
Okay, thank you. My next question is, like you mentioned that you're monitoring wildlife in Halava Stream. How are you doing that?
So good question, Ashley. Thank you. We have a cooperative agreement with the UH group that collects fish counts and other
Biological data.
Yeah, other biological data. Sorry, forgetting the word, but mostly fish species in and around the stream, and also the seasonal flows and so forth. So that's been ongoing for 2 years now, going on through the summer of this year.
Oh, okay. And last question is, like, are water sampling results shared directly with Board of Water Supply? Like, how closely do you talk with them or work with them?
Another good question. We've had several engagements last year when we went through specific results from the long-term monitoring, and then all of our results are posted on a regular basis each month, uploaded to the Safe Waters website, and the dashboard there is pretty straightforward for querying information, but we don't deliberately provide drinking water results to the Board of Water Supply.
Okay, thank you.
Certainly.
Any other questions from FTech members? Joyce, can you move the microphone really close to yourself? Just pull it as close as you can to be comfortable.
Can you hear me all right?
Barely. Get as
How's
close
this?
as you can. That's better. Thank you.
Thank you. Question for Admiral William. Where does the pressure washing water go?
So it's collected in tank 311, and then it is moved out on island to a permitted facility to treat the oily wastewater.
Sorry, just to clarify, so it's contained and then transported
Correct.
off island, or okay.
Not off island here. It's treated here on island at a permitted facility on the west side of Oahu.
Sorry, so it's treated on island and then
Right.
relocated elsewhere?
I'm not sure I follow you. So the permitted facility, they determine once they treat it, what the final disposition needs to be and final disposal.
Sorry, can you one step back? So the water is collected at the tank, the above ground tank, And then where does the water go from there?
So again, it goes to an on-island to a permitted facility that's permitted by the Department of Health for treatment and final disposal.
Can we get clarification today for Department of Health?
Sure. So, the wastewater from tank 311 is transported to a treatment facility in the west side of the island. It's treated using gas, and the effluent then goes to the city's wastewater treatment plant. So it's pre-treated before it goes to the wastewater treatment plant.
And for the viewing audience, Lene is from the Department of Health. Okay.
Thank you. Just another follow-up question regarding the pipeline removal. Which section or where will the removal start?
So still to be determined. It will actually have multiple locations going simultaneously. But we're still working with the contractors because there's deconfliction that has to occur with other activities that are going on inside the tunnels.
And then regarding the extended drinking water monitoring, it's noted here that it completed in March. Is there any further monitoring in the drinking water system or no?
Yeah, good question, Joyce. We completed the last sampling for the program's data set on March 31st. We're still waiting for some of those results. There's a few homes that had obliged to do the sampling. So there's about 2 weeks of additional samples that we'll collect, and we'll upload results to the Safe Waters website. We continue to monitor our drinking water source, Kuahua, very closely. So we're continuing to monitor that every month. And of course, our water quality action team is responding to any calls and concerns, and that will be an enduring effort. And all those results will go up online. But we're standing by for EPA's review of the Q4 results from the effort. We have yet to schedule that, but that'll be upcoming here in the next couple of weeks with EPA, and then we'll be finalizing our closeout report to submit to them for review and approval. But there is, in addition to normal compliance monitoring that the installation does, we have just the water quality action team and then continued monthly sampling of our source water.
For the closeout report, when will that be available, and will that be available for the public to review?
That will be made public. We're looking to finalize that in the next 30 days or so. We have a couple meetings lined up with EPA to walk through. Can't do that until we finish the Q4 period review. So it's several steps to get there, but ultimately that report will be made public, of course. And other data for the extended drinking water monitoring, we're working on an update to the website here this week. I believe today it'll be going live for source water data. Meaning we have a new page that is well recovery, water security related items, and it will include specifically just information on the well reactivation effort for Navy lava shaft, so the conditional approval, the reactivation plan, the results specifically for just Kuahua well, and then the 2 inactive or disconnected wells. We've been monitoring those during EDWM as well. And so all of that data will be on that page. It'll be easy to access, and it's just oriented to the production well information.
Thank you. Sorry, just one last question. You mentioned the IAEA Halava Shaft reactivation. Was the EA conducted for that work being done there?
Environmental assessment was not completed for the Navy IAEA Halava Shaft reactivation. Navy did follow the NEPA process, made a determination that a categorical exclusion applied for this interim treatment facility. It's not a permanent treatment plant. And so we're proceeding with that. And we have several more steps to go, which we're closely working through with the Department of Health. There'll certainly be many public notices to follow before we get to the point of being able to reactivate that well. And we're also going to be hosting a webinar at the end of the month to provide detailed information about the Navy IA Halawa shaft reactivation.
Since you mentioned that it's not a permanent treatment, will a permanent treatment be installed for IA Halawa shaft?
That's a great question, and that is to be determined. So we're putting this one where we have put the treatment system on site, working the approval to get the well back in service and put it back into service, increase the resiliency of the system, while at the same time making a concerted effort to recover the Red Hill shaft as well. So I think that decision or how that comes about is a little bit to be determined, but will be visited in the coming years.
And if you don't mind sharing, what type of contaminants are being treated for at IA Halawa shaft?
Yeah, certainly. So the system is designed to treat for PFAS, but it is also capable for treating petroleum hydrocarbons, polycyclic aromatic hydrocarbons. So some of these main families of constituents that have been of concern in the public and have been discussed recently over the past year with different groundwater monitoring efforts and so on. So it will address all of that.
Thank you.
Great. Dr. Lau. Again, as close as you can to the mic. You can pull the mic towards you. Might be more comfortable.
How's that? Is that better?
Yeah, that's great.
Okay. So you mentioned the water treatment facility in West Oahu. Do you know what it's called? I mean, who is it? Who's treating the water? Who's treating the effluent after you wash the tanks down? Sorry, Renee, yeah.
So it's a Department of Health permitted facility. That's all we're going to disclose.
Okay, Lene is going to address the question. On the lights on? Okay, great.
Pacific Commercial Services.
So Pacific Commercial Services is a private company?
Yes.
That maybe UH is contracted with?
We are not contracted. We've permitted them. Yes.
So then after that, it goes to our regular water treatment facility.
Wastewater.
Wastewater.
Yes. So the treatment system that PCS has. Sorry about that.
All right.
Hello?
Hold on. Just give it a second. We're reworking some audio.
The light's not on. Hello? Okay.
Hold it as close as you can to you.
Okay, so the treatment system at PCS involves an oil water separator and then it goes to a GAC system. GAC system is very similar to what the Navy is using at Red Hill prior to discharge to the Halawa stream. However, in their case, in PCS's case, after it's treated through the GAC system, they do a bunch of testing and they still continue discharge into the city's wastewater treatment system or sewer system for further treatment there. So we consider this kind of like a pre-treatment prior to water treatment.
And do you know what they're filtered out there? Like, how do I say? What have they analyzed in their GAC system has come out of the tanks? I mean, I guess I'm not going to kill something. After the GAC filter, how contaminated is the water still?
So there is in their permit we have treatment, testing requirements, and they have to meet the city's wastewater influent requirements. And actually they have to meet the city's influent requirements for certain things even prior to acceptance at their facility. So they test before they accept it and they test it after treatment prior to discharge to the city sewer system.
Okay, thanks. So, Commander Dunn? Commander Dunn? Hi. So at the last open house, I asked you a question and it was, if I recall correctly, if you've had any hits on any of the homes. And in terms of those 50 extra analytes that you've decided to look at under the EDWM, you directed me to Tracy Meninguez at that time to cull the data off of the Safe Waters website because, as you know, every home is just sort of put on there, but it doesn't have any summary data. And I asked her and I asked you to give me summary data for any positive hits. All the negatives don't matter. What I really wanted to know was positive hits for how much of what they're in what locations. She was not able to get the Safe Waters website to work that night for some reason. So she said, I will get back to you. And I gave her my email. She did not get back to me. So if you could have her follow up and give me that summary data, that would be helpful because, as you know, the Safe Waters website just puts data out there. It doesn't really give any summary data. And I'm a little bit afraid that whatever else you're putting onto the website now will also not have summary data, which makes it difficult to use. Thank you.
Okay.
Or
Thank
actually, could you respond? Yes.
Certainly. I do recall you asking about additional information. The individual sample results are on the Safe Waters website, but to your point, there is additional data being uploaded specifically for the source. So it's centralized there. That's one of the updates that's going up. It's in the process of going up today. And then additionally, as part of the roll up for the EDWM summary, there will be additional information that's going to be posted on the website as well. So there's a lot of updates to the website that we've been working on and working through right now. So there will be more to follow.
Okay. Admiral Williams, those 4 QR codes are helpful and useful, except that I have an Android phone and I have never received a push notification. And I've talked to several of your staff members at various open houses who have tried to help me on this and it doesn't work. I don't have an iPhone, but some of my coworkers have said they do get it and others say they don't. So I would appreciate having the websites actually work. Thank you.
I think the websites work and the app works. If at the next open house, if you're comfortable with us working on your phone, to make sure you get the push notifications, we're happy to help.
Yeah, the push notifications, and I've rebooted everything. I've loaded it, unloaded it, loaded it again.
Yep.
So
technology is a wonderful thing when it works.
Okay. So before we go to the EPA and DOH presentations, just kind of a general thing about audio, and Wes will probably give me a thumbs up if I'm correct. The challenge of doing audio is that in this kind of setting is that people have different volumes natural to their voice. The best thing you can do is get as close to the microphone as you can if you're speaking, almost like you're eating an ice cream cone. That will help Wes to balance the relative volumes. Wes, is that right? Yep. Okay, we got the technical answer to it. So yeah, just remember, get as close to that as possible without bumping your lips into it, and everything will work better. Okay, I'd like to turn it over now to the Department of Health, Joanna Cito, and EPA here with Matt Cohen to provide some regulatory updates to what was discussed earlier. Let's see, who wants to go first? Joanna?
Good afternoon. I'm Joanna Cito from the Hawaii Department of Health Environmental Management Division.
Matt Cohen with the U.S. Environmental Protection Agency, and we're going to provide a brief overview of our regulatory oversight of Red Hill.
There are several ways that the DOH and EPA regulate the Red Hill facility and Joint Base Pearl Harbor Hickam drinking water system. But today, we're going to focus on work required under the DOH's May 2022 emergency order and EPA's 2023 administrative consent order. Both authorities include requirements from the Hawaii Administrative Rules for closing an underground storage tank system, which includes environmental site assessment and remediation, which we'll talk about in a minute. EPA's consent order also has special requirements for the Joint Base Pearl Harbor Hickam drinking water system to ensure it serves safe drinking water.
I'm happy to share that our drinking water team completed all of their action items that were discussed at the last FTAC meeting. This slide summarizes that work. Extended drinking water monitoring, or EDWM, was approved and included in the 2023 administrative consent order. This effort, combined with the long-term monitoring, ensured that water from every home on the Navy water line was tested at least once. Our team collected and analyzed split samples during EDWM to confirm Navy results. Chlorine interference was discussed at a previous FTAC meeting, and our EPA Region 9 lab folks performed an investigation of the chlorine interactions with the lab surrogate to validate the Navy's assertions. Our lab team confirmed that the chlorine in the drinking water was interacting with the surrogate and impacting the TPH results. And so for some background, when testing for TPH, the lab will add a surrogate to the sample, and the interaction between the chlorine and the surrogate created other chemicals that were incorrectly interpreted as TPH. In June of 2024, EPA inspected the Navy drinking water system, and we made some findings. The Navy is working to address those findings, and the report and subsequent comments from the Navy can be found on our website. So at the end of the presentation here, there's some QR codes, and you can, there's one about the water, and you can navigate to the drinking water page. EPA reviewed and accepted the operations and maintenance records and the asset management plan under the 2023 ACO. And just for reference, the asset management plan is intended to ensure long-term and effective operation of the Navy drinking water system. And then EDWM, Extended Drinking Water Monitoring, ended on March 31st, 2025. All exceedances of incident-specific parameters by the Navy sampling were investigated and or remediated and then resampled. All final concentrations have met safe drinking water standards. Next slide. This slide covers the upcoming drinking water work. We're planning to issue a drinking water summary report at the end of summer. That report will include a review of the Navy's EDWM data, our analysis of the split samples that I mentioned on the previous slide, inspections of the Navy drinking water system, an audit of sampling practices, and an investigation of residential complaints. In late 2025, EPA will review the Navy's flushing plans and the Navy source water protection plan.
Under the Safe Drinking Water Act, the DOH continues to oversee the drinking water system as the primacy agency delegated by the EPA. The reactivation of the Navy Aiea Halava shaft is contingent upon meeting certain conditions as listed in the February 7, 2025 revised conditional approval to use letter from the DOH. At this time, the DOH is waiting for the information to meet those 12 conditions. DOH and EPA remain committed to closure and cleanup of the Red Hill facility. The Red Hill emergency order and consent order both require detailed plans for defueling and closing the underground storage tank system. Defueling of flowable fuel was completed from October 2023 to March 2024, and now we're entering the closure phase. Closure includes both physical closure of the facility, known as Phase 1 closure, and the investigation and cleanup of past releases, known as Phase 2 closure. DOH and EPA are reviewing pieces of the closure plan as they're submitted so that work can occur concurrently. I'll touch on a few of the listed items on this slide. The checked items are pieces of the closure plan that we've conditionally approved. DOH and EPA are currently reviewing pipeline removal plan and are waiting to review the plan for final disposition and the updated site assessment work plan that incorporates regulatory agency comments. Overall site investigation and remediation plans are expected after site assessment.
This slide covers the regulatory oversight of Phase 1 closure or facility closure. DOH and EPA ongoing efforts include meeting with the Navy at least weekly to work through issues and concerns, reviewing and providing comments on plans as they come in. This may include tank cleaning, closure, and pipeline removal plans. EPA and DOH conduct walkthroughs to make sure spill mitigation measures are in place, and we continue to oversee degassing and pressure washing. Looking forward, we anticipate overseeing the removal of pipelines and other system components. And we also anticipate reviewing the interim tank closure reports and the final closure report in 2029.
There are a series of environmental work required to close any underground storage tank system in Hawaii. The first requirement is site assessment, which detects the presence or absence of all historic releases from the system. Site assessment is in progress. Then site investigations will determine the nature and extent of each release. For example, what specific contaminants were released and the impacts to soil and groundwater. This is already occurring in several locations where we know there's been a spill. For example, in Adit 3, where the 2021 releases occurred. The final step is remediation, which is informed by all the data collected during site assessment and site investigation. Implementation of remediation occurs following regulatory approval of remedial measures.
So this slide gives a sense of all of the ongoing environmental work at various locations at Red Hill, and you can see it's kind of a mess. There's a lot of things going on. EPA and DOH are providing oversight for each of these projects you see on the screen. Next slide. The regulatory agencies have directed the Navy to conduct several routine sampling efforts to evaluate impacts and ensure protection of human health. So twice a month, there's groundwater samples collected from all of the wells at the facility for petroleum analysis. Groundwater field measurements are collected monthly. This includes things like groundwater elevation and groundwater general chemistry. As the Navy mentioned earlier, the Halava stream is monitored weekly for wildlife and water quality parameters, excuse me. And then during tank degassing and air monitoring, data is collected hourly. In the tank gallery area, that orange oval there, vapor samples are collected beneath each tank weekly. Next slide. So that blue outline shows the portion of the underground storage tank system that the Navy is planning on assessing first. And so that Joanna mentioned site assessment earlier. And it's being conducted to identify all of the historic releases that may have occurred throughout the facility over the 80-year operational period. Next slide. Joanna talked about the typical process moving from assessment to investigation and then remediation. And near Adit 3, there are a few releases that have already been identified, and we've asked the Navy to move forward with these processes in parallel with site assessment. So we're providing oversight for the investigation of the 2021 release at Adit 3, the purple circle there, as well as the two holding tank areas, the red and orange ovals. And in an effort to evaluate remedial technologies, the Navy is working on a soil vapor extraction pilot study near Adit 3. Next slide. So while not from the fuel tanks, we know that folks are interested in the PFAS investigation. And so that's what we have here on the screen. The initial response to the November 2022 AFFF release has been completed. That project was located in that pink oval there. And then DOH and EPA are reviewing the PFAS remedial investigation work plan to address PFAS impacts across the site. This effort also includes groundwater sampling for PFAS at selected monitoring wells. Next slide. EPA and DOH make an effort to make as much information publicly available as we can. You can access our websites using these QR codes on the screen. The last QR code will take you to the Navy's data, and this includes results for air, drinking water, groundwater, and soil.
As requested at previous FTAC meetings, the EPA maintains a calendar of public events related to Red Hill. For example, if you want to learn more about Oahu's groundwater in general, the DOH is planning a basic groundwater series. You can visit the website by using the QR code on this slide for details about this event and more. You can also sign up for the EPA's Red Hill mailing list to receive notifications about some of these events. And we're done. Thank you.
Okay, thank you very much. So a lot of activity. Let me ask the FTAC members if you want to window in on any of the specifics here. Ashley.
What factors determine the preferred remedial option?
There's going to be a lot of factors that go into that. And so we look at efficacy of the technology, the ability to, how much can be removed, how much is it going to cost, what is the ultimate outcome going to be, really?
Mm-hmm.
Where is it? You know, I think that we have to define where all the petroleum is in order to get to that point. And so we're ways away from that.
Okay. And sorry, real quick, what does SDWA stand for?
SDWA, Safe Drinking Water Act.
Okay, thank you. And then this is actually something I meant to ask in the Navy in the previous, but I think you guys can also answer it too. The cleaning report that they have when they're cleaning the tanks. What information actually goes into that report? Like, I just want to make sure that they, you know, account for every drop of, like, you know, cleaning wastewater that is used.
I'm going to ask Drew to help me answer that question.
Okay, Drew is from the EPA, and
excuse me, to develop in-term closure reports. But basically that will be based on the tank cleaning plan that we received.
hold on a sec. You'll have to repeat that last bit.
Okay.
There you go.
Yeah, the interim closure plan, interim closure report will be based on the tank cleaning plan as well as the pipeline removal plan. So what Navy laid out that they're going to be doing in those plans needs to be reflected in the interim closure report.
Will the cleaning report be available to the public view?
Yes, those reports will be available.
Involved in the site investigations. So what tests and methods are used?
So I think Joanna talked about the different steps. So site assessment, we're looking for old releases. And so the way that we've asked the Navy to do that, they're using what's called the passive soil gas sampler. So it'll pick up any indication of petroleum. And then once we sort of know where all of those releases are, we'll ask the Navy to put together a plan to define the nature and extent. So how big does it go? How deep does it go? Those kinds of questions. And right now there isn't a defined technology. So I think you probably know that the geology at Red Hill is quite challenging. And so we're all going to have to put our heads together to figure out the best way to do that. So it's not been defined yet.
Okay. And is there any more information about the Navy's Aiea Halaba reactivation plan at this time?
I'm going to turn that over to Dennis Lopez, who is online.
Hi, can I get clarification as far as what type of information you're seeking?
Just more information about, like, what is that? Like, what's involved in the Aiea Halaba reactivation plan?
The NAH, are you referring to the 12 items that we're requiring from them in our conditional approval?
Yeah, any information is helpful.
Yeah, I can't speak to too many specifics of their treatment operation. It is considered critical infrastructure, but safe to say that we're requiring that a pilot test be done, which the Navy mentioned, notification to us in writing, as well as stuff like additional testing for that triggers from the lead copper rule because you're adding a new system that what we want to see is whether that disrupts the system in any way. And that, there's, and it's kind of spelled out in notifications and sampling and testing.
Okay. Thank you. Thank you for clarifying that.
I do want to point out that the PFAS contamination that we are looking at is because the levels require treatment. Those levels were known before I believe in 2019. And so at that time, PFAS was unregulated. It is in their CCR, so it was made known to the public. It was deactivated for a period of time. And as the Navy mentioned, they want to reactivate it. In order to do so, that we're going to require treatment. We do not think it's coming from Red Hill. We do believe, or we suspect it's coming from an unknown source down gradient. So just want to provide additional clarification.
Okay. And also, just so everybody knows, the Navy's team is still online. So feel free on the Navy side, if you want to jump in, clarify, address anything as well. Just, I guess, put your hand up. But you should be prepared to be able to be involved still too. Okay. Sorry, Ashley. Continue.
Oh, okay. Just one last question. And I think that you guys pretty much answered it. The regulatory agencies pretty much answered it. You guys do walkthroughs of the tanks, right? So I'm assuming that you also inspect, after the Navy submits their cleaning report, do you guys personally look at the areas that they cleaned, or do you just go off of the report?
Again, I'll ask Drew with EPA to jump in on that question.
Yeah, so for the conjunction with the interim closure report, there will also be an interim closure inspection where EPA will be on site. But to your point that you mentioned before, myself and DOH are frequently at Red Hill overseeing the operations of Navy's for the pipeline removal and the tank closure.
Great. So let's move along to anybody else on that. Okay, Joyce, and yeah, as close as you can to it, please. You can pull the mic towards you. You don't have to reach over. There you go.
All right. Just one question. Will the public or Board of Water or subject matters experts have the opportunity to provide inputs during the site assessment, site investigation plans for consideration and implementation?
So the subject matter experts, including Board of Water Supply, are invited to participate in the discussions about technology and approach during the subject matter expert quarterly meetings and the Red Hill remediation roundtable meetings.
So that will be coming up in the coming weeks, right? So would that be brought up?
Yeah, that's correct. I mean, I think for site assessment, it's been discussed at the most recent meetings, and the idea and the approach has been kind of talked about along the way. And just to add, I think the regulatory agencies are open to discussing these kinds of topics at other public forums like open houses or CRI meetings.
So can the site assessment and site investigation information be shared with the public as well for their review? And
I believe the site assessment work plan, the initial work plan, is posted online, as is the responses from the regulatory agencies.
Where online?
The responses for sure are on our website. I'd have to double check to make sure that the work plan is posted online, but we can follow up with you on that.
Hey, Matt, it's also on our website, our document library. The work plan can be found there.
Thank you.
Okay. And maybe we can put the EPA's website in the chat so it's clear to people where to look. We can do that during the break if necessary, if we don't have that right away, but
it's also on the slide. At the end of that slide, there was those QR codes.
Okay. And by the way, for everybody, especially online, all of the presentations you're seeing today are on the Department of Health FTAC meeting website. So no need to worry about missing something. It's all there.
And for those that are in the room, I don't know where they ended up, but there were some fact sheets and there's an environmental fact sheet. And I believe there's a direct QR code to at least our response to the site assessment.
okay, thank you.
Dr. Lau.
Just a short question. The actual sampling of the groundwater and the soil that's going to occur with the site assessments is going to be conducted by Navy personnel or an independent lab or a contractor chosen by the Navy?
Yeah, typically with environmental cleanup, the responsible party will hire a contractor to do the work for them, which I believe is the plan here.
And the DOH and EPA will oversee these contractors?
That's correct.
Okay, and then the source data, the actual numbers they get will be available to the public, like?
So currently, the Navy, and we talked a little bit about the ongoing sampling that occurs, and so they're collecting biweekly sample or bi-monthly samples from all the groundwater wells, and so all of that data is available on the Navy's website, the Safe Waters website. We also have EPA has a tool that kind of pulls from their website and displays it in a little different fashion. So that data is public, and happy to work with you to access that if you need.
So the data that EPA pulls is in a summary form, as I was trying to ask Commander Dunn to make their data into a summary form because the Safe Waters website is impossible to use.
Yeah, I think you were asking about the EDWM and the LTM data, and so our tool doesn't pull EDWM and LTM. Our tool pulls the groundwater data, and so you can sort of filter and sort and kind of summarize data on our website, but it doesn't include the drinking water data.
I thought you said it was going to be on the Safe Waters website.
The data is on the Safe Waters website, and what I'm saying is, you had originally asked about the data that we're collecting for the environmental work, and so that data is posted on Safe Waters as well as our site.
Right, but what I'm trying to say is that it's an unwieldy set of data, and so it would be really helpful. So like the registry people didn't have to go one by one and try to figure out how to make a map. It would be really helpful if there was a summary, and I have not been able to, in the last 3 years, to get you guys to give a summary. I mean, not necessarily you, but also the Navy. So
yeah, I'll let the Navy answer about summarizing their data, but
you're telling me though your EPA data is summary.
We do have a tool that allows you to sort and filter. I don't know if you would find it easier or harder than what the Navy posts, but we have a tool that is intended to allow users to sort of look for the data that they're interested in.
Maybe a little clarification. You are talking about groundwater data that's collected by this app and tool, not drinking water system data. There's two different
There are
sets of
two
data.
different systems.
Right. So I just want to clarify that
But
that's what he's talking about.
I'm saying that both EPA and Navy have made it difficult, or if I find it difficult, to try and cull the data that I want, which is basically positive hits of what, when, and where. So if there's nothing to hide, why should not that be easy to find?
Yeah, and I would offer, at an open house or after one of these meetings, I'd be
the open houses. And like I said, it didn't quote work on the night I was there. I mean, she was supposed to give me a report and it never occurred. And actually there's also something, I don't know if he's Captain Barkley or Admiral Barkley was also supposed to give me, and he did not.
Okay, so let's allow the Navy to respond. Go ahead.
See two things. One, right, the Safe Waters website has two parts to it, right? Groundwater data, which was what Matt's referring to, and then our drinking water data, right? Every user looks at data in a different manner. Safe Waters website provides the raw data to allow users to access it and do whatever they want with it, right? But it is free and open access to every piece of data, every laboratory results out there. How people want to slice and dice it, that's their individual choice, but it's there available. That raw data is there available for them to do so.
Okay. So unless there's any more questions, I think we actually have a good amount of, we're keeping on this agenda at least. So I want to thank, all who presented on this last topic. Before the break, we're going to just go to one more presentation. This is by Dr. Don Thomas at UH, and it has to do with the the tracer study that's underway right now. So Don, if you want to jump on and we can see and hear you.
Okay, can you hear me okay?
We can hear you. There you are.
Okay, very good. And I'll share my screen, and we'll get started. Okay, can you see my screen now?
Not yet. It's not showing up. If necessary, Don, we can run the slides for you. Okay, now something's happening. Okay, now we can see it.
Okay, and let me make it full. Okay, I'm having trouble.
You want to go to presenter mode?
That's what I'm trying to do. There we go. There we go. Okay, I was having trouble. Now, can you see it?
Well, it's okay. Now we have it. Yeah.
Okay.
Yep.
Okay.
Thank you.
Sorry about that. Okay, so this study is part of a much larger investigation of the hydrogeology of the Red Hill area and surrounding what we refer to as a Pearl Harbor Basin. This particular study is intended to really develop ground truth information on rate and direction of groundwater flow. In our prior work and the current work, what we found is that this region geologically is extremely complex. We believe that we have a multi-layered groundwater system that is at least partially compartmentalized, both in the vertical and horizontal directions. And they have widely varying permeability, and they have actually somewhat variable pressures or hydrostatic heads. And under these conditions, predicting the direction and rate of groundwater flow is simply destined to failure. So these dye tracer studies are going to provide us with some ground truth data that we can use in sort of the conceptual modeling and numerical modeling for groundwater flow here in this region. Basic design is fairly simple. We inject some quantity of a benign, easily detected tracer into one well and either chase it with flush water or let it disperse naturally. And in this case, what we are using is rhodamine WT. It's a commonly used tracer in the hydrologic community, both looking at subsurface groundwater flow as well as tracking stream flow and water flow within large open basins. It can be detected down to quite low levels, to 0.015 microgram per liter, using a laboratory fluorometer. The next step after we inject the dye is to monitor surrounding wells for the arrival of the dye plume. And we're using a variety of techniques to monitor for the arrival of the dye and to quantify the amounts of dye or concentrations of dye showing up at various wells. We do direct sampling where we simply collect a sample of water, put that into a laboratory fluorometer and measure the concentration of the rhodamine WT. Secondly, we have semi-continuous monitoring. There are tools, downhole tools that you can actually install in a well that have a miniature fluorometer within them, and they can measure at 5-minute, 10-minute, 2-hour intervals, whatever you set them for, to make measurements of the rhodamine concentrations in the water that instrument is in contact with. And then thirdly, we are installing a suite of activated carbon packs, and those are periodically recovered and the dye is extracted. The carbon packs will adsorb the dye, take it up from the water that is flowing through that dye pack, and we can extract that dye and analyze it for the concentrations of dye that have accumulated over whatever period of exposure. And the overall process is to collect that data through the arrival of a dye plume and then track it as the concentrations decay over time. And I'm just showing here kind of a generic dye tracer study that was done elsewhere, where actually two different tracers were used. The higher values here are actually chloride. The lower value, in this case, I believe, was fluorescein. And time zero is when the dye was injected into the injection well. And you can see the monitoring began within several hours after the injection of the dye was monitored in the monitoring well locations. And initially, no dye is seen, but then fairly rapidly, we see an onset of the dye plume rising to fairly high values, and then a decline over time. And in this case, is very confined region where this study was done. And so the dye plume passed through very quickly. Another example that actually is closer to home, this is a Lahaina tracer test. This was done by our colleague, Bob Whittier was involved in the design and execution of this test. And in that case, dye was added to injected wastewater, and monitoring locations around that injection well were sampled periodically. And again, they found a very characteristic dye arrival plume, a peak, and then an extended period of decay over time. So this is what we anticipate seeing in some of the wells that we're monitoring. Now, speaking of the wells that we're monitoring, this is the set of wells that we have access to for this work. And the green points, or the green flags, call them what you will, the RHWS, that's the Red Hill water source, essentially the pump discharge from the wellhead, from the Red Hill shaft. And the shaft itself extends sort of up and across the ridge. So water is coming from somewhere within the location of the infiltration tunnel of Red Hill Shaft. RHMW08 is the well in which we injected the dye. And these other wells are available for us to monitor using one or another of the techniques that I mentioned. So to go through those, we have transducers, or these fluorometer, installable fluorometer sensors. We have 5 of them installed. One is at Red Hill Shaft. It's testing the water about every 10 minutes. This is water that's coming out of Red Hill Shaft before it goes into the GAC treatment system. The water that passes by that transducer then does go into the GAC treatment system and is disposed of along with the rest of the water Red Hill Shaft is pumping. We have 5 other wells surrounding RHMW08. You can just sort of see the green here. That's the injection well. We also have a transducer in the injection well. And so what we're looking to do is to catch the influx of dye in any of these points as that dye plume disperses, and be able to very precisely tell the arrival time. And that will give us a very good indication of the rate of water flow in that particular direction. For direct sampling, we have several wells, including Red Hill Shaft, that we go in on a weekly to bi-weekly basis and collect water samples. Those water samples are sent off to a laboratory that specializes in dye tracer studies. And as I mentioned, they can detect rhodamine WT down to 0.015 micrograms per liter. The results so far are shown here. Takes a little bit of explanation. And I'm sorry to throw kind of a lot of numbers at you. There's only a few of them that are important. The values that are cells that have BR/ND, that stands for background. Whenever we're doing a type of study like this, we want to get background values before any dye goes into the water so that we understand what the background level of fluorescence is, so we don't confuse something that's naturally present with our dye tracer. So we collected a number of water samples for background and got non-detects, of course, on all of them. But subsequent sampling, we continue to have non-detects on the samples that we have collected from either with the transducer or water samples from Red Hill Shaft. They are also non-detect. Now, as I mentioned earlier, it's a dangerous game to make predictions about the rate and direction of water flow in an area as geologically complex as this. Some of our more expert consultants on the project were anticipating seeing dye from the injection at monitoring well 08 within 5 to 10 days at Red Hill Shaft. The Red Hill Shaft seems to be very closely connected to monitoring well 08. And as I say, a lot of people were counting on seeing the dye show up at Red Hill Shaft very, very quickly. So far to the present date, we have not seen any evidence of dye influx. So if we accomplish nothing else on this study, this is one accomplishment. Everybody's expectations have been disproven. The wells that I show, the well designations MW27, RHMW02, RHPO103, and MW30 are wells that we have the carbon packs in as well. So we are sort of doubly sampling many of these wells. And the carbon pack data is where the carbon pack deployments are shown here. And the carbon pack data for most of these wells have come back non-detect. However, we have had some detections of dye at several of these wells. The levels are fairly low. Unfortunately, the concentrations that we see here are the extracted concentration, or the concentrations of dye in the extracted fluids. And they don't relate to the concentration, and according to our contractor, they can't be related to actual dye concentrations in the water. But we have had significant hits at these various locations, and I show where those locations are here: NMW27, RHPO3, NMW30, RHMW02, and RHP01. Now, this presents us with a real puzzle because the carbon packs appear to be detecting dye. The direct sampling does not. Now, we could argue that the carbon packs are a more sensitive receptor for the dye, but In the data we have so far, we're not seeing anything that looks like a rising set of concentrations that would be associated with an incoming plume. In fact, what we're seeing is decreasing concentrations at these locations. And we've looked at these data very carefully. And unfortunately, we haven't drawn any clear conclusions, but we've begun to suspect that we're having cross-contamination issues, that our field crew has not been sufficiently diligent in protecting these dye packs from contamination in their handling of the packs and installation of the dye packs. As I say, this is not a final conclusion, but it's difficult for us to believe that we're actually seeing water transport rates as fast as would have to occur. It's about 50 times what we expect to be the normal transport rate for groundwater in Hawaii to get from RHMW 08 to NMW 27. It's also a little bit difficult to understand how we can have dye transported to NMW 27 and RHPO 3 without showing up at all in Red Hill Shaft. And I neglected to mention Red Hill Shaft has been pumped at about 4 million gallons a day since the dye was injected in RHMW 08. So again, we're continuing to evaluate the data. We just had a meeting with the contractor who specializes in these dye tracer studies. We're continuing to do some forensics on this to allow us to draw better conclusions on the dye packs. But that's kind of the status of those data right now. So the remaining work for the study, as I say, this is our current status. We have data continuing to come in. The only conclusion that we can draw at this time is that the travel time between RHMW 08 to Red Hill Shaft is significantly longer than was originally anticipated. We honestly don't know at this point how soon dye will show up there or if it'll show up there at all. We're going to continue to evaluate the early carbon pack results to determine whether they're true detections or the results of cross-contamination. And we're going to continue to monitor the dye concentrations for the remaining duration of the project. And with that, I think I'm done and ready to answer questions. Thank you.
Okay, thank you, Don. So it's a complicated set of data and methodology as presented, but FTAC members, and including those online, let me know if you have any questions about the study so far. Again, and Don, just to clarify, when do you expect the conclusion of the study overall?
Well, excuse me, our field work is anticipated to end October of this year, and we'll have a period for report writing of several months after that.
Okay, thank you. Okay, Dr. Lau.
I was going to ask a similar question. Your last statement is until the duration of this study. So the study is going to end in October?
Yes, that's the planned conclusion date. Certainly, if there is a compelling reason to continue this work, I mean, the university is happy to continue it. But that is our current period of performance ends in October.
I think you already have that answer, that you do need to continue because you don't even have one data point yet. I mean, the flow is going slower than you expected. You trust your method because you've already used it in Lahaina, which probably has similar volcanic composition of the rock that we have here on this island. So therefore, I would think your method is probably okay. But since you don't have any data points yet, if you end the study in October, how are you going to not know it's going to be 3 years from now? Because your other studies showed 6-month time periods, right? So maybe it's slower, maybe it's going lateral, maybe it's not going the way you thought, maybe you have to have different sampling points, but I guess my whole point is if we end in October, we're never going to know, are we?
Well, again, it's hard for me to, excuse me, anticipate, what we're going to see over the next several months. As I say, if there are compelling reasons, and there's funding available, the university team, is more than ready to, continue this work. And I should add too, that, this is something, I'll get on my soapbox a little bit. I mean, this is the most detailed study of the hydrogeology of any aquifer in Hawaii that's been done in the last 75 years. And we are learning a tremendous amount. And I will also maybe challenge one thing you said that, non-detects are still data. Non-detects do tell us something. So they are important as well.
I agree with you. No data is all, I mean, yeah, a non-detect is also a good result. But so that brings up a corollary question. Who does fund the study? And is it at risk of ending because of no funding?
This current work is being funded by Office of Naval Research.
Ah.
Joyce?
Just for a little bit more clarification, for the carbon pack detection concentrations, what unit are they in? I think it was just a standard number.
Yes, as micrograms per liter. I should mention one other point too, that I neglected to mention in the presentation. We did actually find evidence of contamination at the wellhead with dye, which should not have happened if proper field protocol had been followed. So we are very definitely following up on that.
And then also just, I think, on your slide number 2, you mentioned injecting a significant quantity of the dye. What is a significant quantity?
Okay, the quantity that we used for the study, we injected a total of 50 pounds of the rhodamine WT dye. It was injected in 5 separate injection episodes over a total of 6 days. And chase water was injected to help force it out into the formation and into the broader hydrologic system.
Do you have an estimated concentration of what that dye is after you've injected the dye with water?
I'll have to get that for you. I can't pull that off the top of my head, but I can certainly get that to you. We did figure that out, but I can't pull it off the top of my head right this second.
Yeah, just a thought, because
yes,
depending on what the concentration is at the initial injection, I noticed here on your slide saying that the fluorometer can detect down to approximately 0.015 milligrams per liter. Considering that our aquifer has so much water, and then you inject the dye, once it dilutes, will it even actually detect that concentration?
Okay. Yes, and in fact, okay, I can get that. I got that for you now. Okay, each kilogram of dye was diluted with 1,000 liters of water. So that is 1 gram per liter, or 1,000,000 micrograms per liter, is the effective concentration of the dye going into the aquifer.
Joyce, do you have a follow-up or?
No, yeah, I was talking with Dr. Lau, just the diluted concentration, once it hits the aquifer, it's so low that, do you think it would still be detectable by the meters?
Uh, yes, definitely. We expect it to be detectable. As I say, it starts out at a million micrograms per liter. We can detect it down to 0.015 micrograms per liter. So that's about a 10 million to 1 dilution.
Maybe what might help, if I may, Don, do you know what the concentrations were used for the Maui study you referenced? Were they similar to what was used?
No, I don't have the details on that.
Okay. Ashley.
Hi, sorry, real quick. So you mentioned the potential for cross-contamination, right? And you're trying to rectify that. How long do you think it would take to rectify that or correct that?
Well, I mean, to draw the conclusions, I think what we need to do is to, number one, do the testing at the wellheads to see if there is less visible evidence of dye contamination there, and then look at the deployments of future dye packs and see if the concentration continues to deteriorate, to go down, because really what the dye packs are intended to do is to catch the leading edge of the dye plume. And as I say, if we're seeing a continued decrease, then that says that, okay, those probably were not real detections, that there was just simply contamination and residual contamination at the wellhead that we're seeing in those subsequent, because they drop by like an order of magnitude from one dye pack to the next, where we had multiple detections at a given wellhead.
Okay, and how long would that take before you go, oh, okay, before you can reach a conclusion and go, okay, it's this or that?
Well, I think we can sort of reach varying levels of certainty in our conclusions with time. I think, in a month from now or 2 months from now, we'll be a lot more confident in our conclusions with regard to the likelihood of contamination than we can be right now. And if 6 months from now we still haven't seen any dye at using the conventional methods at these locations where we got those preliminary hits, then I would say my conclusion would be pretty solid by then, that now these can't be real, because it would not just appear one time and then disappear instantly. That's not how these dye plumes work. So that's kind of how we are approaching this. We're going to let the data tell us, what it can tell us.
Okay, yeah, thank you for clarifying that. I just wanted to know, because just to echo what Dr. Lau was saying, you definitely need to extend this beyond October, if that's the case too.
Okay. Any other questions from FTech members, including those online? I'm not seeing any hands. All right. So we're about 10 minutes over our usual or allotted time, but that's okay. Let's have our break at this point. Just 3 quick announcements. 1, restrooms outside to the left. Second, if any members of the public want to speak during the public comment period later on, please sign up. Otherwise, we won't be able to call on you. We won't know you. And Roxanne, if you could raise your hand, she's the one who has the sign-up sheet. And of course, that doesn't apply to the Zoom participants. You just raise your digital hand online. And I believe Allison has to take care of a personal matter. So Matt Cohen will be sliding over for a little bit of time to represent the EPA after the break. With that, let's have 10 minutes. I've got 3:14. Let's get back here at 3:25. Thank you very much. Aloha, online audience. We're just getting back, reconvening. We had to solve a few technical issues, but we're ready to restart the agenda. So I'd like to call upon the Navy's team to address number 5 on our agenda, which is the fuel constructed underground fuel storage tanks, not at Red Hill. So let's turn it over to the Navy team and roll with your presentation. There we are. We can see you.
Good afternoon. Can you hear me all right?
Yes.
All right. Good afternoon. I'm Captain James Sullivan. So I am the regional engineer representing Admiral Barnett for Commander Navy Region Hawaii. With me, I've also got the Deputy Commander for Joint Base Pearl Harbor Hickam. Colonel Grambling is sitting next to me in the room here, as well as online. We've got the Commanding Officer of Pacific Missile Range Facility. Commander Stevenson is also, or Captain Stevenson is also on the line. So today, do you have my slides up as well? Okay, perfect. Okay, so today, this FTAC, I'll be discussing the other field constructed underground tanks. We'll be providing an overview of 3 different areas. We've got the Hickam POL Annex that I'll be talking about, the Kuahua Peninsula, also known as the Diesel Purification Facility, and then I'll hit on Pacific Missile Range Facility. So as you can see on this slide, they're broken into 3 different categories. We've got those that are permanently out of use. We've got those that are temporarily out of use. And then we've got those that are currently in use. So those are the 3 different categories that I'll be hitting on as we go through the next few slides. Next slide, please. So first 2 sites that I'm going to refer to, these are both the Hickam POL Annex. Site 1 is the Kipapa. This site consists of 4 2.65 million gallon tanks that are permanently out of use. The tanks were operated from 1943 until 1993. They're located in central Oahu, above the underground injection control line. Back in 2002, all of the tanks and pipes were emptied, they were cleaned, and they were welded shut. A response action memorandum decision document was approved and signed by the Department of Health back in February of 2012. And in coordination with the DOH, selected remedies, including long-term monitoring, land use controls, lead-impacted soil removal, and bioventing were completed. The annual groundwater monitoring shows that the contaminant concentrations have been stable or are decreasing over time due to natural attenuation that is occurring. The next, I'll talk to the lower half of this slide about the Waikakaloa site. This site consists of 9 1.75 million gallon tanks that are also permanently out of use. These tanks were operated from 1943 until 1993. They're located in central Oahu, above the underground injection control line. In 2002, the tanks were cleaned and welded shut also. A record of decision was approved and signed by the Department of Health back in October of 2009 with a no further action decision made. All monitoring wells and bioventing wells have been closed since 2012, and no further monitoring is occurring or planned at this site at this time. Next slide. The next site that we'll be talking about, this is the Kuahua Peninsula, also known as the Diesel Purification Plant. At this location, there are a total of 8 different tanks. 3 of them are 25,000 gallon tanks and 5 of them are 1,000 gallon tanks. This facility is below the underground injection control line and not above a drinking water aquifer. The facility has been out of operation since 1990. Back in 2021, we completed work on to empty, clean, and secure the tanks and the piping with intent of temporarily closing the facility. 5 of the tanks are temporarily closed. 3 of these tanks were emptied and cleaned, but the Navy later filled them with groundwater infiltration that was coming into the tunnel. The contract that was in place back then removed most of the piping in the tunnels. They were cut, they were cleaned, they were capped. But some of the piping that was underwater, under the groundwater infiltration, cannot be cleaned and cut at that time. So we are currently working with the Department of Health. We had a meeting last week on April 1st to make sure that we continue to move forward with figuring out what is needed for the temporary and ultimately the permanent closure of this facility. So we'll continue to work with the Department of Health on what those requirements will be and develop a contract that will take care of that. Moving on to the next location. So those are the ones that are on the island of Oahu. We'll now move over to Pacific Missile Range Facility, PMRF. The only field constructed underground tanks in operation within the region of Hawaii. This is the last of them. There are 9 total tanks. Each is slightly greater than 51,000 gallons. 5 of these USTs were removed from service between 2019 and 2023 due to reduced operational requirements. But 4 tanks on this facility remain in service. And for these 4 tanks, they continue to successfully pass the monthly detection tests for compliance with UST regulations. They're inspected regularly in accordance with the API 656 standards, the American Petroleum Institute inspection requirements. The Navy plans to replace these underground tanks with above ground tanks by 2038. The compliance records are maintained and at a designated UH approved location on PMRF. So those are, I know that was kind of a down and dirty, but a quick summary of all of the other Navy-owned tanks on both Oahu as well as PMRF. So at that time, I will stand by for any questions.
Okay, thank you, Captain Sullivan. Let's move to FTAC member questions. Ashley?
Hi, yes. When will the decision regarding Kuahua's closure be finalized? Do you have a rough idea?
For Kuahua?
Yeah.
So I believe that one we're still working with it. Right now there is not a decision made. We're still working with the Department of Health to figure out what is going to be required to close down the facility. The target contract is going to be awarded in about 2026 after we get the scope of work clearly defined through the discussions that will go back and forth with us and the regulators.
That has been closed since 1990, you said, right?
It has not been utilized since 1990, so it has been temporarily out of service, but it is not closed.
Right. Okay, and then the second question I had was, when will the tanks be replaced with above ground storage tanks at Pacific Missile Range Facility?
So the target, we do not have projects in place now, but the target for that is 2038.
Why that date? Like, why not sooner?
So all of the tanks that are currently there, they are compliant. They have secondary containment and everything. The reason, I guess, that what's driving 2038 is it a federal? I guess I'll have to.
Sir, do you want me to jump in?
If you could, yes, please. I mean, I know that that data is important.
Lieutenant Commander Kimball, the Public Works Officer over at.
Yeah, go ahead, John.
So yes, that regulatory requirement is 2038 to have those tanks out of the ground. We are planning on completing much sooner, and there is a project that we are currently going through the NEPA process of completing a categorical exclusion to include a 106 consultation, which has recently been submitted to SHPD. So it should
John,
be
can
well
you please
before 2030.
John, could you just please identify who you are and your appointment or whatever?
Sorry,
So John Kimmel is the Public Works Officer for PMRF. He works directly for Captain Stevenson as his Public Works Officer.
Okay, thank you.
Okay, thank you.
Yes, sir. So yeah, that's. Okay, Skip, do you want me to introduce myself again?
Yep, good to go. Thanks.
Okay, got it.
Okay, Joyce? Yep, you're on.
Okay. Thank you. Just
Yeah, let's move that as close as possible. Thanks.
okay. For the Kipapa fuel annex, can you explain what sort of materials or chemical was previously stored there, and if there's been any leaks or what? Well, I think there are leaks, but can you just explain to us what those leaks were and when those
So
were?
I apologize. Which annex were you speaking to?
The Kipapa.
Kipapa. So for the Kipapa site, I do not have a complete record that show. We do believe that there were leaks, historic leaks at that site, but I do not have a comprehensive list of what exactly those leaks were and when they occurred prior to 1993 when this facility was no longer operated. The products, you asked also what products were stored and utilized. It was avgas, MoGas, JP4, and I believe JP8.
So would you say the remediation actions that's taken place there with the long-term monitoring, land use controls that impact soil excavation and bioventing, has those been effective?
And that would be something, obviously, we've done all of this in accordance with the Department of Health, their response action memorandum, and the decision document. Yes, the concentrations of TPH, they have shown reductions over time. So that would be an indication that it has been successful.
And also for the Waikaka Lalua, what was stored there? That's the site right below Kipapa.
I believe they had it is the same as the Kipapa site. So it would have been the avgas, the MoGas, the JP4, and JP8.
Was there any investigations done to sort of verify the validity of the no further action is needed?
So we did not do any further investigation after the Department of Health made that determination that no further action was required.
And how, if I may ask DOH, how was that determined?
Kathy?
I'm not sure that anybody in this room can tell you, but the file is available if you want to come and review it. The cleanup was done in accordance with our rules, with our state contingency plan.
So the plan is available online, or is it a physical copy that we would have to request for?
It's available online.
Okay.
On our I Hear website.
That's all I have. Thank you.
Okay, thanks, Joyce. Dr. Lau? You can pull that mic closer to you so it's more comfortable.
I kept turning it off and on. Can you hear me now?
Okay.
I couldn't, I'm sorry, you guys talked over each other and I don't want to know who John, the public works officer is, and maybe just John can say who he is and what his role is again.
So I'll jump in and speak for him. So John Kimmel, Lieutenant Commander John Kimmel, he is the Public Works Officer. So he works directly for Captain Stevenson, who is the commanding officer. He also does work for me and support me as the commanding officer of NASBAC. So he lives and works on PMRF as the Public Works Officer for the installation.
Okay. And I couldn't hear the 4 things you said was stored at Kipapa and also at Waikaka, or the other place. Can you say it again slowly?
Yes, avgas, aviation gas, MoGas, JP4, and JP8
Okay, and that was stored at both sites, right?
at both of those sites. Yes, ma'am.
Okay.
And just for clarification, MoGas, is that motor vehicle gas?
Yeah, yes.
Okay. Any further questions from FTAC members? Okay. So good. I think we caught up a little bit. Thank you, Captain Sullivan and John Kimmel, for providing that information. So now we're going to shift over to the last part of our agenda before the public comment period. And I'm going to turn it over to Kathy Ho, who is the chair of the FTAC committee, and she'll walk us through everything.
Yeah, sure.
And if you could pull that mic as close as possible.
In October, at our last meeting, there was an inquiry about maybe holding FTAC meetings 4 times a year. Or quarterly. Right now, we are doing it twice a year. And as we try to get back to what the FTAC is supposed to be about, which is not only about Red Hill, but about the others, we're wondering, the question comes to mind, do we need more or do we need less? Or do we need to, are we able to do all of our meetings online? Or do we want to do hybrid meetings? I mean, as I look around the room today, we have more FTAC members and agency employees than we do the public. I think we only have 2 public members in the audience. And so we want to start thinking, we need to start thinking about that. And also, as we move more towards the remediation of Red Hill, and as we are ramping up, we also have to be cognizant of the fact that FTAC is not the only place where people can get their information on Red Hill. There are EPA CRI meetings that I think is going to be recommissioned, and I think they're going to start their first meeting next month.
This month, April 24th.
This month, April 24th. So there's that. There's the webinars that we have. There's the open houses. There's other, the Navy attends the Remediation Advisory Board. The Navy also has its quarterly open houses. There's also CWORM and the Board of Water Supply meetings. So there is a lot of other places that the public can go to get information on Red Hill. And so just judging from the amount of people that are here, I'm wondering if, the request for a quarterly FTAC meeting is really warranted. And so as a result of our the query last in October, DOH staffers kind of put together a table, and it goes back 2 years. So in June, we had June 23, we had a meeting at Mauna Loa High School. The cost of that to rent that facility was $32,170. There were 40 in attendance, 80 online, 140 in attendance, 80 online and 60 in person. And as a result of that meeting, we had 32 public comments at that meeting, both live and written, and we had 12 FTAC members in attendance. In November 2023, it was at Blaisdell, and that cost us $14,822. And in attendance, it was 93 people. 63 were online and 30 in person. And for the public comments, we had 16 written and oral comments and 9 FTAC members present. In March of 2024, we had 83 total attendance, and that was at the Hawaii Convention Center. That was at a cost of $14,665.23. 83 attended, and it was 60 4 online, and 19 in person. We had 12 public comments and 9 FTAC members were present. In October, we had 54 members, attendees, 49 online and 5 in person. We had 7 public comments and 8 FTAC members. So we can see that there's a trend of a decrease of participation for the last 2 years. And so I open it up for, if we do want to do it quarterly, we definitely have to go back to the ledge to get some money for this, because it is not a cheap endeavor. And also, but we could, try to do this fully online. I don't know if that's, I'll have to check with our lawyers to see if that's possible. Or we can keep it at this 2 times a year. So I open it up for discussion.
Okay, well, thank you for your input, Kathleen, appreciate it. I think that, you're right that there are a lot of other opportunities to kind of like get information about Red Hill, but I think that the FTAC meetings are kind of special in that it's the only time that you can see everybody kind of in one place, so to speak, even though it's like a hybrid kind of situation and interacting with each other. So that's kind of a unique vantage point, if I may offer that. That's my perspective.
Well, I think also, though, with the reenactment of the EPA CRI meetings where the Navy and EPA and DOH will participate, and the public will also have an opportunity. There are CRI members are members of the public, I believe. There's also that opportunity.
Okay, well, we'll see how that goes. The last time was kind of rocky, but yeah, FTAC meetings have been kind of rock solid in that, even though there's like a downhill trend in participation. There are some key players who keep coming and, keep participating. I'm one of them. So yeah, that's my perspective.
How's that? No? Okay. So I get what you mean by the budget. That is something that we have to consider. FTAC, I think, has been a unique opportunity to actually face the Navy across the table, who actually was not here today, which I found surprising. So if we go to an strictly online method, this will continue, where they will not be across the table, where I can look at them and see what notes they're passing back and forth, the body language, the rolling of the eyes, whatever. And I think that's actually important for me to get an idea of whether our points are being made or coming across clearly or not. I've seen furrowed eyebrows, and so I've, tried to clarify my question even more, which I will not always see online. And I'm sorry, but I had a really hard time understanding and hearing them. I think they probably have several layers of protection so that they're not hacked, but it also means that their transmission is not clear, which is better when we're in the room, I think. So anyway.
Thank you. So thank you, Kathy, for looking into this and following up on this inquiry. And the Board of Water Supply, we are in full support of increasing the frequency of these meetings. Thank you for the trend table that your staff had to put together. And I do notice, like you mentioned, that there is a trend of reducing attendances. And I just want to bring to your attention that this meeting is being held in the middle of the week on a Wednesday during work hours, school hours. And that brings the issues with normal, community members. They can't just drop everything. They can't stop going to school, going to work, attending to family needs just to attend this meeting. So I think if we want to increase public attendance, maybe we can look into maybe a meeting session on the weekend so that others can actually attend and we'll have better feedback and better attendance. And just echoing what Ashley and Dr. Lau mentioned is that FTAC is a very unique venue where the public can attend and sit right across from regulators, the Navy representatives, and really have an open dialogue and discussion. Also have an opportunity to ask questions directly. And it's not something that's available through, a virtual meeting. With a lot of the virtual meetings that I've attended with EPA as facilitator or the Navy as a facilitator, is that the chat rooms are very highly monitored and controlled. So sometimes some questions don't really get translated over or get actually posted for the members to respond to. So I think with that, I would highly recommend further investigating the feasibility of increasing the meetings. I think that would help bring more transparency to our committee. Thank you.
I forgot one more thing is the frequency of the meeting. It tends to be that Navy will drop their latest proposal just before the meeting and say, the Department of Health hasn't had time to evaluate it. And we'll say, well, okay, we'll do this the next time. And then that's 6 months later, when probably most of us forgot what the point was already. So if we have one every 3 months, we can have shorter questions, shorter timeline, more quick answers and turnarounds. Even if the answer is, I don't know yet, like the tracer study. Okay, well, we can stay on top of it. Well, we can't stay on top of it if it's every 6 months.
I think Claire may want to say something.
Sure. Claire Trombador with the US EPA. Kathy, thank you for bringing this to the FTAC to discuss. I want to start off by saying that EPA supports these meetings. We support FTAC, and we also have found them a very useful place to exchange ideas, to answer questions, to interact with not just other FTAC members, but also with the community. That said, I think that the semi-annual frequency has been working. We do have many additional engagements with the community and the public. And so I think EPA is not in favor at this time of having more frequent FTAC meetings. So that's all I just wanted to share. I think also I will add, we're having a lot of challenges with attending meetings that involve a lot of travel for us. We're having very serious budget issues. So I so appreciate that this is hybrid so that many of our team we can fund to come out if they're not already on island personnel. But then, of course, those of us that cannot attend in person, we can participate virtually. So I appreciate that option. Thank you.
Well, I just have to say, for the Department of Health that has to fund these meetings, we're unable to do quarterly meetings this year. I mean, we have to go back to the legislature to ask for money to fund this. So until we are able to get back into the ledge, probably next session, to ask for money to fund these meetings, we would have to stay at 2 times a year.
How about a compromise of online meetings quarterly? That would be, you would not have to pay for the room, but we would have sooner deadlines for responses to questions. That would not require going to the ledge for more money.
Let me ask, do we have a quorum of the FTAC members?
I don't know exactly if quorum is defined as half plus one. And you have what, 18 members? I can't remember the number.
Also, an idea is if we keep the existing in-person 2 meetings a year, but we add 2 virtual meetings so that it becomes quarterly meetings. That could be an option. You're not increasing the funds.
We have 15.
15. Okay. So, I mean, I don't know if FTAC has bylaws that cover this, but you know, if it's majority plus one or half plus one, then, you know.
We need 8 members to vote.
Yeah.
Do we have 8 members today?
We have online, let me turn to the panelists. We have Ryan Amata, if he's still on. And we have, the Navy has a seat on it, and we have Nicole Lowen. And I'm looking. Kiara is online. So that's 4 right there. And I'm looking for Meg, who is representing Senator Gabbard. Meg is on, that's 5. Okay, so you actually have 10. Assuming that they're all ready to unmute and vote.
But we don't have a motion.
Right. If that's what you're looking for, though.
Do you want to, I'm asking the FTAC members, do you want to table this and bring it up again next? So that the other members of the FTAC can think about it and vote, or?
Well, I was going to say, I don't know how to make a motion exactly, so I will start one and maybe you guys can all chime in. I move that we have quarterly meetings, 2 online, 2 in person, so it's not that much more onerous. That the meetings be held in the evening or weekend so that more public participation, which seems to impress the committee, can happen. Chime in, you guys.
So I think you should make it
I
in
second.
2 separate motions so that it's clearer.
Okay, well, are we going to vote on both motions then?
No, I think you should vote. Your first motion is quarterly meetings, 2 online and 2 in person. Is that your first motion?
Okay, yes.
Okay, I second that motion.
It's moved and seconded that we have 2 meetings online and 2 meetings in person. It's
or hybrid rather, right? Because in hybrid will encourage more participation, right? Okay. Right.
Do you want to restate your motion?
Sorry. It can be in person. In person, just 4. I think we can just go through this. Okay, 4 meetings. Okay, 4 quarterly. Okay, quarterly meetings, 2 hybrid. 2 in person and 2 online, alternating.
Alternate? Can you explain that?
Well, online person, online in person.
Okay. Is that your motion?
Yeah, I guess so. Want to second it, Ashley?
Okay. I second the motion.
Okay, it's been moved and seconded that we have 4 meetings, the first being online, the second being in person or a hybrid, and alternating in that fashion. Is there any discussion?
Maybe before you ask for that, can we make sure that the FTAC members online heard? And if you heard the motion and understand it, could you just put a thumbs up? That's not a vote. That's just, have you heard the proposed motion? Three.
Should we require the FTAC members online to turn on their
Yeah, it would be
cameras?
good. If the FTech members online, just the members, not everybody. Yeah, just have your camera on and unmute yourself. Great. Okay. And is Representative Lowen? Okay, you got Navy on. Representative Lowen, if you're on, and also Meg from Senator Gabbard's office. I'm seeing 4 of the 6.
Sorry, I'm just trying to get my camera.
Oh, okay, okay. Is that Rep Lowen?
I think that was clear.
Oh, Meg, I can't get my camera to work. This is Meg.
Oh, hi, Meg. Okay. So, well, we can hear you, so we know you're there. And Rep Lowen, I don't know if you're able to either say or put your camera on, that would help. Okay, I'm not getting any response. So you have basically 4 additional members online plus the 5 of you. So 9 altogether.
So for this vote, what I'd like to do then is, well, does anybody online or in the room have any discussion about this motion?
I just want to make sure I understand the motion. It's 4 meetings a year, quarterly, 2 hybrid, 2 online only.
Correct.
Okay.
Okay. Any other questions about the motion itself?
Would each meeting still be 4 hours long, or because there's more meetings, would they be?
No, not necessarily. It could be longer or shorter.
I hope
Depends on the topics and the participation.
Okay.
Okay. All right. So for this meeting then, for this
one motion.
For this motion, let's do an oral vote. For the members of the public, Ashley Nishihara, how do you vote?
I vote in favor of the quarterly meetings.
Okay. For Board of Water Supply,
Yes.
member of the public, Dr. Melanie Lau, how do you vote?
Yes, in favor of the motion.
EPA?
No, in favor for keeping the same.
Representative of, let's see, the Senate,
Senator
Senate
Gabbard.
President, Senator Gabbard, or his designee?
Yes.
Okay. Ryan Imata?
Yes.
Kira for the chairperson of the Commission on Water Resources?
I'll vote yes.
Okay. Motion is carried.
Thank you. Shall we try the second motion?
Sure.
I think a good point about public participation is that a lot of people are working or, going to school during the day. So an evening/weekend meeting would be preferable. If we're going to have 4 meetings a year, did you want to do 1 and 1, like one hybrid and one hybrid and 1 online? Every other would be, or have 2 day meetings and 2 evening meetings. I mean, I know you guys don't want to do the evening and night meetings, but I think if you really wanted more public participation, the public needs to have evening and weekend meetings.
If I could just offer one couple of professional
Go ahead.
viewpoints on it. So I don't have a vote in this, and it doesn't matter to me what happens. But running a lot of meetings over the years, there's never a perfect time or place. Somebody's always going to be inconvenienced. And I know that, even many of the agencies in Hawaii who have regular public meetings do it during the day. The second observation.
Keith, you've been muted. We can't hear you.
We can't hear you, Keith.
No, audio still lost.
We could table the exact timing of it because I would rather have a discussion,
Okay.
right? I mean, so is that okay with you, Kathy? We table that second motion of trying to find an evening and weekend time, possibly to the next meeting, 3 months from now? Sure.
Okay, I guess for the 4 members online, if you didn't hear what was happening, the point I was trying to make earlier, just as a suggestion, is that, there's never a perfect time or place for a meeting. There's always going to be somebody inconvenienced by it. And, it's common practice for public agencies in particular across the board in Hawaii to often do theirs during the day. The second part is that presenters from the East Coast would have a real challenge participating in a meeting if it's in the evening. Weekends, I've always found, is really a mixed bag because some people, they've got kids, they've got things that they need to do and they want to do. And meetings like this are not always at the top. So it really isn't a slam dunk that you're going to get more participation. I just wanted to offer that as insight. But turn it back over to Kathy because I guess you've got a way of clarifying this now based on the motion.
Right. So as I understand it, Dr. Lau, you have withdrawn your motion on the timing of these meetings and tabled it till next meeting. Is that correct?
Does that mean it'll be on the agenda for next meeting?
It will be.
It
Yes.
will be? Okay. All right. All right. That sounds good.
Okay, so we're done with that bit of business, I imagine, right? At this point?
Yes.
Good. Okay. So now we're going to move into the public comment period. And I've asked for those in the room who want to speak to sign up. And so I have a list of 3, and we'll go with that. For attendees who want to participate, do you want to make put up your digital hand. You will rise to the top of the queue. What we're going to do for people in the room who want to speak, come up to that microphone that I'm pointing to right now, and please make sure you get as close to it as I am so you can be heard. And then we're going to toggle between the online people and the audience people. So let's go ahead and start with Susan Picola Davis. And then the next one will be an online speaker, Meredith Wilson. Meredith, you'll be prompted to get in the queue. Or you're already at the top of the list. You'll be prompted to unmute yourself at that time. Okay, and last thing, let's try to keep these to 2 minutes each. You can say a lot in 2 minutes, believe me. And if you're looking for answers to questions from any of the speakers who are still on, remember, the best guarantee to get a clear answer is to ask a clear question. Doesn't guarantee it, but that's your best guarantee. Susan.
First of all, I want to state that I'm speaking as an individual with my own slice and dice using Faith Water's website.
And I'll say also that it's been a long journey. And this is my research and data gathered for me to understand the data during the extended drinking water monitoring, and also to share with the public and others. So I'm not going to go over each one of these, but one of the things I've learned, something else to share is what you've learned, is that in March of 2024, we had Chris Waldron explain to us the different types of total petroleum hydrocarbons, and it's probably taken this long for me to understand everything that he said. But the purpose of me talking about it today is that there's three types: petroleum, biogenic, and pyrogenic. And these different types of TPH show up in the sampling, and it's about tier assessments to determine whether it's actually fuel or it's one of the other two. Anybody can correct me, but that's the way I understand it. So what they did was they decided to use a different kind of sampling for EDWM in order to remove the residual chlorine, to make the sampling cleaner and to eliminate cross-contamination. So as far as the three types, petroleum, as we know, is crude oil, JP5, and other fuels. Biogenic is from algae and bacteria, and pyrogenic is produced by combustion. And I have this broken down because I need to understand it to actually have a conversation with you all. So I've had conversations during the open houses with the Navy, and during the December 10th meeting with the Board of Water Supply and the SWARM team, one of these slides that didn't get addressed because time ran out or whatever it was that they do this second, I'm going to call it forensic testing, to determine whether it's actually fuel. So along the line, my journey, I kept finding fire hydrants, and I kept asking myself, Susan, you got to find out, because it's bugging me, not you, but bugging me. And I found out that the reason why they're finding anything coming out of the fire hydrants is because you have to lubricate. And in order to do that, the purpose of this is to avoid damage to the components of the hydrant by providing lubrication to internals, including the valve seats and seals, and it's vital for preventive maintenance. But most importantly, is food grade. So it's not anything that's going to make you get sick. And out of their presentation during the no, they didn't actually present it, but I grabbed the slide in order for me to understand it. They had two findings that were in homes, and both of them also became, one was a lubricant, one was skin contamination, contact in the lab, and the other one didn't have a tiered result, which is going to be maybe a recommendation I make to the Navy, that they add a column into their safe waters. So after they do the tier assessment, they can finalize the whole circle. And the good news for me, I only had 35 findings through the whole year from March to March. 17 of them were fire hydrants, which I already explained, and the rest of them were homes. And what it amounts to, 1%. 1% findings that have not, in my availability to get the data, I have not been able to show that they are, a tiered assessment has been done. So, I always believe in giving credit where credit's due, and I did this back in a while back. And remember, these are my remarks. Don't email or put me on Facebook because you didn't agree, because I don't care. Giving credit where credit is due is looking at the hard work that everybody put into this and giving them the appreciation and the recognition that they deserve. So I'm not going to name names, but I'm going to say the Navy, the Board of Water Supply, the Department of Health, the EPA, Curtis, of course, who always monitors this. And if there's anyone that I missed, I'm sorry, but you're in my heart. And only one recommendation after I'm finished is that we need a clearinghouse for all the Red Hill documents so that you don't have to bounce around between the EPA site, the Board of Health site, and the Navy. Thank you.
Thank you, Susan. Okay, we're going to move online, and then next in person, Paul, you can take a seat up there by the microphone so you're closer to it, but we'll go first to Meredith Wilson. So Meredith, if you can, there you are.
All good?
Yes.
Aloha, everyone. To state the obvious, it's an utterly exhausting task that we're all undertaking here. Some of us voluntarily, like the regulators who entered their careers to protect people and the environment, and many of us involuntarily, like those of us who became ill, all due to just using our home's water. Question to DOH, is it true or false that in order to restart the use of the Navy's Aiea Halava shaft, they will not be required to test for TPH since it is not listed as a regulated contaminant for reactivation? After all this time, one would hope that the regulators in the Navy would come to know the community's priorities. Has TPH not been a useful indicator for identifying contamination for these past 3 years? I can tell you this with certainty. None of us are going to be satisfied with the reopening of this well without testing for TPH, and all the testing results should continue to remain available to the public. There's also been a well-documented issue of the Navy's public water system not having enough or even the ability to prove the amount of certified operators in charge at any given time. This is required for the restart, so is this going to also be addressed? To the EPA, for you to end up foregoing the Navy's $5,000 stipulated penalty for failing to even show up for a required meeting, how can we be comfortable knowing that you're also ultimately in charge for safe drinking water enforcement? And lastly, to the Navy, has there not been an official response to the 3 DoD Inspector General reports from November 8th of last year? We certainly hear a lot from you about what you're currently doing, which is helpful, but this publishing was just ignored. The horrific and chaotic state of Red Hill's management and response to the water crisis that the reports clearly presented should be acknowledged, especially since it is what contributed to us being poisoned. I wish I felt better about our progress in regards to trust, but that's not going to happen overnight or in 3 years. Mahalo not for just hearing us, but hopefully listening to us and keeping our safety and your commitment to serve us always at the top of your minds. Olai kawai. Thank you.
Okay, thank you, Meredith. So there were questions asked to 3 different entities, so we'll go in that order that you asked them. First from the Department of Health, if you remember the question.
It's Dennis online.
Yeah, I was gonna send it over to Dennis.
Okay, Dennis Lopez, if you could. There you are.
Yeah, one clarification, are we referring to Navy Aiea Halava shaft or Red Hill?
Navy Aiea Halava, that's been given conditional approval already.
So we did tests for TPH at NEH. There was detections of TPH in that testing under forensic analysis. The nature of the TPH is biogenic. It's all fatty acids. It's not related to jet fuel or any fuel compounds. The report is online in our tier 1, our phase 1 forensic analysis, which includes testing at 12 homes that had detected levels of TPH, as well as the 3 sources, active and inactive, for Joint Base Pearl Harbor. In all cases, there were no detections in Waiawa and NEH.
Okay, now we can move to EPA. Allison or Matt, whoever wants to field the question that was asked.
We're going to turn it over to Amy Miller,
Okay.
Director of our Enforcement and Compliance Assurance Division.
Hi, Meredith, would you mind restating your question? I just want to make sure I got it. There was a lot to unpack in your statement.
I understand it's hard to pack, several months into a brief thought. But my main thing was, there was a stipulated penalty of $5,000 for the Navy not attending a required and agreed upon meeting. And it's not very clear about the process of why that was foregone. And it's not going to take place. We felt like it was a small win because, a small enforcement of that, not just financial number, but for just a meeting versus trying to get all these plans together, multi-decade plans together. How can we feel comfortable with knowing that you guys are in charge of big problems and little problems like that?
Thank you. Thank you for your question. So our goal at EPA is to make sure that the Community Representation Initiative meeting happens as part of our settlement. And we do have that available to share. We have asked that the Navy provide more notice to us when they're not going to attend a meeting. But I am pleased to announce that we are going to be having the Community Representation Initiative meeting on April 24th. And that is, to me, the most important thing is that we get these meetings to start happening on a routine basis.
Is that settlement viewable on EPA's website?
I believe so, yes.
Thank you.
Okay, and the final question was to the Navy. So I'm assuming Captain Sullivan, are you still online? Or anybody from the Navy team? There we are. Okay.
Hi, Kate. This is Captain McCormick. I'm filling in for Evan Williams. He had to depart on travel, as we discussed previously, so I'm the Chief of Staff here. Ma'am, thank you for your question regarding the Department of Defense IG report. We are in receipt of that. We understand the corrective actions involved in that report, and we're taking them on board, reviewing them both in how we operate and how we incorporate moving our plan forward, both to close and decommission Red Hill. Alongside those actions in that report, they mirror the actions and corrective criteria in similar reports that were not by the IG, but internal to our own. So it reaffirmed our commitment to make corrective actions, and it aligns with the things that we self-identified. Also added some additional things that we did not identify, so that was good. But we did incorporate them in what we're doing right now, and some of the good news that you heard here, but we're always looking to improve that. And so we do routinely, recurringly go back to look at that report to see if we missed anything. But yes, it is a rear-looking report that we recognize has corrective actions for us to take on board, and we continue to do so.
Thank you. And you will have the correct number of certified operators on duty and available for reference for these folks in the room, like EPA and DOH. As a public water system user, that would be of high priority.
Okay, excuse me. I guess thank you very much, Meredith. We're going to move to the next speaker, who is Paul Ayer. Is that correct? All right. Paul wanted to ask a question, I think, directly of Don Thomas, and I reached out to Don. I'm not sure he's online. So Don, if you are still online.
I am online.
Oh, wonderful. Okay, thanks. Paul, step up to the mic. Try to get as close as you can to it. Thanks.
You tell me. Good afternoon, Don.
Hi, Paul.
So let me set the context and a scenario, and then I'd like to get your response to it, okay?
Sure.
Okay, so we know the aquifer is composed of layers of lava flows. The flow of groundwater is much, much easier along horizontally along a lava flow and much, much more difficult vertically across them. The fact that Red Hill, okay, and you injected your dye relatively near the water table, I believe, relatively.
Yes.
So, okay, so the fact that no dye has showed up at Red Hill Shaft seems to indicate that Red Hill Shaft gets its water from different and deeper layers than where the dye was injected. Okay, so okay, so do you think this explains why it is taking so long for the dye to get to the Red Hill Shaft, if it ever does, at detectable levels? And might it be good to inject at the Navy's Red Hill Monitor Well 3, I believe, which is right next to Tank 5? That seems like it has a pretty direct connection to Red Hill Shaft. So your answer and how you might address all this with your dye test.
Sure. Well, there's certainly that possibility, as well as some other possibilities. The Red Hill Shaft, as you know, I'm sure, and the infiltration tunnel extends well back into the base of Red Hill Ridge. And we've had some discussions that, and again, there was, when the infiltration tunnel was constructed, they put a shot hole in the very back end of the tunnel that produced a substantial volume of water. And so it's possible, this is one of the things that we've discussed, is that that water is in fact artesian, moving into the shaft, and is actually increasing the so-called local water table within and adjacent to the shaft, such that it's going to be very difficult for pumping at Red Hill Shaft, or for the dye that was injected at RHMW08 to in effect move uphill against that gradient and be taken into Red Hill Shaft. So that is certainly one possibility. We injected the dye in RHMW08, and we didn't distinguish or try to isolate where that dye went. Some of it clearly went into the shallower part of RHMW08, where there's reason to suspect that the water is fairly stagnant. But there's also a section of RHMW08 down near the bottom where water flow is much more rapid. And so it is possible that sort of the shallower water that could potentially be drawn into Red Hill Shaft is in a very stagnant regime, and it's going to take a very long time to get into Red Hill Shaft. It's also possible that much of the dye went into that deeper, more rapidly moving zone. And as I said in my introduction, that these things are not necessarily well connected, and it could be flowing somewhere completely different from the vicinity of Red Hill Shaft. So, that's what we're trying to find out.
Right, and it'll take the coming months to get the
Right.
data that elucidates the picture.
Right.
Thank you, Don.
Sure.
Great. Okay. Thank you very much. We'll move on to our next online speaker, Catherine McClanahan.
Yeah, how's that?
Yep.
Yes, good evening. I I just want to comment, considering I never did hear from the Navy, Williams or Dunn, the last FTAC related to my questions regarding missing samples and delays, absence of 2-ME testing, and further, never heard from any of them. So I want to tonight to circle back and talk about delays in 2021. So I think that especially considering the DoD IG report and just lack of the public, we have not heard anything from the Navy regarding that. We don't seem to get answers. We aren't able to ask questions of the Navy at CRI meetings as a public to receive answers. So I want to talk about the delays in 2021. And it's significant to me because the delays were indicative of the negligent practices that the DoD IG report found. Those delays included reports that the Hawaii Department of Health themselves said took 6 to 8 months to receive water test results from the Navy. I went over last FTAC. The labs were finished with those testing within about 17 days on average, but the Navy took 70 days to release those results on average in 2021. But the delays didn't just stop there. And I think that's what of concern to me is how do we assure that somebody, either EPA or DOH, is looking into what was happening at the Navy during those time of delays. And those delays extended also into quarterly reporting period. So the sample time periods in 2021 grew drastically. First quarter was 10 days, second quarter 2021 sampling period grew to 20 days, third quarter 29 days, and fourth quarter sampling to 42 days. And to give you perspective, 2022 was 12 days on average, all of the sampling periods, 2023, 11 days. So when we are looking at these significant delays, and I continue to look at the water reports available on the Joint Base Pearl Harbor Hickam site, Safe Water site, I just want to ask the EPA or Hawaii Department of Health, are you looking into what was happening during these delays? And second of all, there are states that require laboratories to release water test results directly to regulators due to problems that you experienced yourself with not receiving timely reports. And those reports included drinking water sample exceedances that our families consumed without your knowledge of even the results of those tests. So I would like to know, has anyone at the EPA or DOH ever considered the fact that it's time that the Navy be required to release, have their laboratory that tests for them, their subcontractors, release water test results directly to you and stop this practice of, quote, validating results. Those validating reports only come about once the Navy releases those reports to the validating company. And finally, I just would like to know who at the Hawaii Department of Health or EPA is investigating the numerous, and I can count to you nearly a dozen reports from 2021 that contain such fraudulent, negligent looking chain of custody records, to include chain of custody forms that have no numbers, chain of custody forms that have no signatures, no temperature markings, blanks and seals that are missing from those water test results, samples that were being sent to these labs. So I guess my question would be, is anyone looking back at 2021, all of 2021, to understand that the November leak happened after a May leak and after months and months of delayed practice of turning in water results? So thank you for any of your help answering any of these questions.
Okay, so I'm not sure which of you want to address that first. Questions really directly both to EPA and DOH. Actually, two parts questions. Matt?
Yeah, I appreciate, you're looking into the data, and we did get some questions from you. I think it was several months ago, and we worked with Department of Health, and we looked through a lot of the things that you pointed out, and prepared a response. I think a thoughtful response about what we were seeing in the data. And so, I think sitting here today, it's a challenge to sort of comment about specific things or when we talk about a label missing or a temperature missing or things like that without being able to really dig into the data. And so, as always, I think we are happy to help answer your questions and look at what you're seeing. We just need, if you want to send us specifics, again, we'll work with you to answer those questions.
Okay, before going on, any comment from Department of Health?
We would appreciate receiving all that information also.
Okay, so let me ask this. How would I go about scheduling? Because here's what I find happens. There are patterns of practices, right? You can nitpick one particular test and go, oh, all 4 chain of custody forms within this single report have no numbers on them, and explain away a single report. Or the lab saying that they received samples on 2 different dates for the chain of custody records. How do I go about scheduling a meeting and talking about, I guess, it in its entirety versus I can send you one of a dozen reports of where the chain of custody forms, like I have a master's of science. I am not an environmental engineer, but I know basic chain of custody record. No one in high school or college would say that those are approved practices. But if I send you a single one, I feel like it's unfair to both you and me because it may be the very single one out of the dozen that has an explanation. So help me understand that.
I didn't mean just the one. As we look at the bigger context, we'd need to, like you're saying, we would need to see everything that you're finding. So that would be helpful.
Okay, so I can contact you all to schedule a lengthy meeting, one-on-one.
I'm looking at my team. I would have to coordinate this with them.
Sure, that would be great.
Yeah,
Okay.
I think certainly reach out and we'll figure out the best way to work with you.
Okay, thank you. And
Great.
I will reach out. Thank you.
Okay, thank you. Now we have one more online speaker who had requested to speak, but I'm still seeing that the Michelle Poplar hasn't accepted the promotion. It's kind of a technical term, but you have to basically respond. Michelle, are you there and ready to speak? If not, we're going to have to move on to our next speaker in person. And she just popped out of the queue. Oh, well, gosh, she's ready. So, Michelle, I know that you received a notice before to unmute yourself. There you are. Okay, thank you.
Hello, aloha. I just wanted to say thank you. Big mahalos for showing up and being here to all of you. I know this is a big responsibility and I appreciate that. My question is, does the Navy have any plans to all these beautiful websites, QR codes? Is there any plans to submit this information in a monthly newsletter to all of the property managers that handle like the leaseholds? I live in Kapalina Beach Homes, for example. Like if Kapalina had a monthly newsletter from Let's Talk Red Hill and a QR code link to the remediation app, if we had that monthly coming into our inbox as an affected resident, that would really help rebuild trust in my community. And the property management has access to all of our emails. They would be able to send us updates of meetings like FTAC, for example. We could include all of that and get more community participation that way. So I encourage all of the entities here to utilize the property managers that manage Hickam Communities, Kapalina Beach Homes, Ford Island. Just sync up to those property managers, send out the information in the form of a monthly newsletter, like a Let's Talk Red Hill newsletter, and communicate that way. Let's just keep that line of communication open and utilize resources like property management to get the word out there. This is my strong suggestion. The other suggestion I made about 6 months ago was that the Safe Waters website, the hotline number is very hard to find. You have to go to page 2 and scroll down to the bottom, and it's a little box, and it's in gray, and it's very hard for people to find. So if that could be in a more prominent position in case somebody suspects contamination in their home, that would be great. Thank you.
Thank you, Michelle. And if anybody from the Navy has a response at this point, have at it. Otherwise, we can follow up. Yeah, Captain McCormick.
Thank you. Hey, it's Captain McCormick here. Hey, man, thanks for your question. And one also, thank you for bringing up the podcast, or as we could say, the podcast. We're really trying to get that message out that we do that on a routine basis. And we're always looking for additional topics that the public are looking for to be informed about. As far as your monthly update, we've actually taken that a step farther. We do weekly updates. We have the Red Hill highlights as part of a newsletter that comes out every single week. It's available to the public on our website and the app. The newsletter is constantly evolving to answer the questions that we receive via FAQs or other to ensure that we're kind of feeding that information to the public that they desire. And then as far as that phone number, apologies for that. We'll take that on board. We are revamping the website and adding a resource section. So we'll take a look to make sure that number is front and center and that those folks who need it can get a hold of that. That should be good to go. But please let us know if that could be improved in any way. Thank you.
Great. Okay. So that concludes the online speakers, and we had requests for one more in-person speaker. It's actually Dr. Melanie Lau. You don't have to go up there, Melanie. You can stay where you are. Just pull your microphone.
Okay. Can I sit? Can you hear me?
Not
yet?
Yep,
How's
you're
that?
getting louder.
Okay. So now I'm wearing my regular public member hat. I'm not an FTAC member right now. I have more of an observation to make. Actually, watching Susan and John, I learned, and this is what I think FTAC is important for, is that people can bring their comments and suggestions, and there's actually the experts here who will act on it or at least take it to heart. And, I'm really glad, Susan, we found out that everything's good now with the water, and I think John left, I never thought about that maybe the dye packet didn't go low enough and there's artesian and there's all different kind of flows. And so it's nice that it works this way. My request to Navy is that you don't talk at us anymore. You should talk with us because people really do have ideas. I'm not sure how the CRI thing is going to go again. I didn't even realize Navy had decided they wanted to participate once more. But people in Hawaii have ideas, and also you lost a lot of the public's confidence and trust. And so to rebuild that, you might want to be a little more open to suggestions, give and take a little more rather than just talk at us like at the open houses with your vlogs, with your website issues. I mean, you pretty much talk at us and not with us. And to that effect, I liked your map on the injection line, which I guess is not showing up anywhere, but it was pretty much most of Oahu is green for the aquifer, and the other parts are where we don't have aquifers. And if you notice, it's mostly the military bases. And so one way you could really curry favor with us again and also build our confidence is maybe actually talk to the state and the city and put the new dump somewhere on one of your facilities, because you're pretty much the only place that is not over an aquifer. Comments?
So I guess for clarification, you're talking about the proposed landfill relocation.
Yeah.
Which
sorry,
is,
landfill. Thank you.
Yeah, I understand. Navy, if you have a response at this point, we'll go back to you. Otherwise, we'll maybe take that under consideration.
Hey, Keith, Captain McCormick here. I don't understand the question. Is there a specific question regarding that?
Yeah, if I could clarify, you may be aware that the Oahu needs to replace the current landfill, which is out in the Waianae Coast, and move it imminently, but there's no as yet approved site for it due to the various requirements that it not be close to any residences, but also not be over any aquifer. So I think Dr. Lau's question was, well, could it be in one of the DoD areas which is not over an aquifer? Am I correct? Is that the, okay.
Yes, thank you. That's
Okay.
better than I did it.
All right.
No, I appreciate the question. As a longtime Oahu resident, I am tracking that, but unfortunately, it's not really an FTAC subject matter that we can discuss, or nor is it part of the Navy Closure Task Force mission. But I do acknowledge that's an issue that's out there for the DoD. So, that's probably good for another forum.
Okay.
How about you kick it up the chain of command, which tends to be the usual response?
I think he's unable to delve into it further. He's obviously indicated he's taken the suggestion.
Okay.
But with that, I want to turn it over to our illustrious, Allison.
I just had one follow-up to an earlier question. Wanted to provide an update to Meredith Wilson's question and then let her know that we did check on the EPA website. The dispute resolution document wasn't posted on that website, but we did send it to her and we will be posting it within the next few days.
Okay, thanks. And just as a reminder, check out the DOH FTAC website. It's got all the, information that was presented today. And I know there are a lot of websites for all of this, but that's where the information will be held. I want to turn it over to Chair Kathy Ho to adjourn the meeting.
Thank you. Thank you very much, everyone. Thank you. Thank you, everyone, for coming and for the lively discussions. And the meeting is adjourned.
Mahalo.
See you next time.